but he was being frustrated by the so-called management committee. Thank you.
I think
Juma, you can take like 3 questions. I'll go to Honorable Jagagwa and Honorable Wino and Professor.
Thank you, Madam Chair.
Senior, I'll come back. I'll come to you. Proceed.
Thank you, Madam Chair. I'll just pick it from where my colleague Vice Chairman has left it. My opinion, and this is my opinion, is that the Director of Procurement is being mischievous. I was being mischievous by his advisories. The reason is this, and that's my statement, Madam Chair.
Honorable Jagagwa, kindly put up your mask.
Thank you.
Thank you.
If you look at all the letters of award to any given entity, they were never signed by the CEO, Dr. Jonah, but they were signed by Charles Juma. All of them. I have my file here, and there's not a single document that is signed by Jonah Majali. My statement is that what Juma is trying to do is to throw the CEO under the bus. My statement again is that at this point in time, you now know that you are alone, and God follows all. So why did you have to sign all these letters knowing that you were overcommitting KEMSA? Yet on one hand, you write your advisories. On the other hand, you sign the award letters. That is actually conflicted personalities. Or even double speak, assuming you are speaking. But by dint of your letters of award, you're actually doing a double speak or conflicted personalities. That is one. Number 2, and Madam Chair, if you may, with your kind permission, that is why I said when we had a discussion with my senior that I'll get back to issues of award letters. There is a matter that I raised yesterday, and I raised it with the KEMSA board when they were here. Juma is by no means, he is well versed in matters procurement. That is why he's a director of procurement for KEMSA. There's a company called Lego Freighters. It is, when you go to the list of directors or the certificate of directorship, it is actually a business name whose sole business, as authenticated by this letter from the director, by the Register of Companies, is to carry out the nature of clearing and forwarding. Then how did he have to award them? How did he have to award Lego Freighters the tender for the supply of surgical masks, 60,000 pieces, amounting to 270 million? And these are people who should be carrying out the business of clearing and forwarding. I will refer him to Article 227 or 227 of our Kenyan Constitution, which says that public funds must be well utilized. Again, I will also refer him to what we are calling Section 30 of the PFM Act, that you cannot commit an entity, and you are the one who is committing, not even the chief executive, it is you, by your hand. You are committing that entity. I don't even think you have the powers to commit the entity. Procuring goods outside the budget that has been approved. Madam Chair, if you look at, again, Section 53, 8 and 9 of the Public Procurement Act, again it says you cannot commit when there's no money. So I put it to you, Bwana Juma, that your actions have actually brought Mr. Manjali on this floor. You have visited you by dint of your hand of a commitment. Your actions have visited the unfortunate events that you are finding Daktari in. In fact, I saw yesterday, and that leads me to my third question, Madam Chair. there was correspondence which was brought to us yesterday by the CS. The CS, Honorable Mutai Kagwe, and the PS, Mochache, Susan. There are clear letters from, I think, the director, Mr. Muredi, commercial director, where he is advising that they should not be doing more procurement. And now again you find Mr. Muredi here, by dint of Juma's actions. He's the one who has made this gentleman to be kicked out of the office. Madam Chair, again, if you look at the letter, now that will bring my question to the chairman. If you look at the letter from the Ethics and Anti-Corruption Commission of that 13th August 2020, it clearly advises the board to have these three gentlemen out of office to read for investigations. But Madam Chair, you heard Mr. Morelli speak for himself. And there are correspondences from Madam Ochache, the folder that was brought to us yesterday by Madam Ochache and Mr. Kagwe, Honorable Kagwe. There is nowhere, and you've heard Mr. Morelli explain himself out, there is nowhere that the commercial director is involved in procurement. So then, Honorable Chair, why send a gentleman who is not involved in procurement, whose only duty is to receive goods that have been procured, away from office? I think for now, Madam Chair, no, I will also ask Juma, what kind of procurement were you doing? Was it a restricted tender or was it a direct procurement? And if it is either direct or restricted, if you go to section 74 and 75 of a direct procurement, there are conditions which are spelled out clearly when you should do a direct procurement. I've gone through those conditions one by one, and there is not a single one which talks of a pandemic, that during a pandemic you can do a restricted tender or a direct tender. You can read all of them, either in the old Procurement Act or in the current one. If you go to section 104 of the current one, they have again spelled out instances when you can do direct or restricted tender. But not a single one talks of a pandemic. So then how? And that now leads me to my question. How did you ever, as a director of procurement, advise the board, advise your senior management team to go for direct tender or direct procurement or restricted tender, when the act is clear that these are the instances, 7 of them or 5 of them, when you can do direct tender, restricted tender, but none, not a single one of them mentions the word a pandemic. So where did you get the authority to advise the board and your senior management to do direct or tender? So I put it to you, Bwana Juma, your actions, your acts of omission, acts of commission, has led to this management and the board being dragged to this house, because you indeed misadvised them. Thank you, Madam Chair.
Thank you. And members, the other team was supposed to come in the afternoon is here, so I would like we go direct to the question, so we may be able to interrogate and also have the other team. And Sergeant at Arms, because we might not be able to take a health break, if you're able to get a few snacks for the members, you can just give them to where they are seated. I can see our senior energies are going down. So, Honorable Wino, and to the point so that we can be able to wind up.
Thank you, Chair. I'll be very brief. Kamsa, you know, I've been a very good advocate for you because I know the distribution efficiency, which I have been witnessing where I was before, up to the dispensaries. So I've been a very loyal advocate. But what I'm hearing from the Director of Procurement and also Office of the CEO, then my first question goes now to the chair of the board, because you hire these people. Their job descriptions, what they're supposed to do, and what they are not supposed to do. So question number one, who is legally, according to the company policy, supposed to sign commitment letters? Is it the CEO? Is it the director of procurement, or both? I think that needs to be clear. Second question goes directly to Mr. Juma. You said almost 9 commitment letters you didn't know. Who signed them? Can we get copies of them to know where the problem is? Lastly, Chair, I think all these things we are gathering, we are doing so for the good of this country. So eventually, even from your standing point, Chairman, would be able to reform KEMSA, review how the structures and this tripartite arrangement, the ministry, the board, and the management, how they should work in coherence so that we don't delay, misappropriate, or lose public funds. So we want you to take this positively, that what we are doing here as a committee is to make this institution, which I love very much, function better than it is doing now, having heard how these different sections are playing each other. Thank you, Chair.
Thank you. Could we allow Mr. Juma to respond? Or Senior, do you want to go? Not to go away, just to ask a question.
Yeah, that's what I mean. I know what you mean.
Yes.
The senior management here is not telling us everything and actually causing themselves and everybody grievous harm. Going by what Mr. Juma said, I haven't heard the finance director make any comment. They have full information as a group, and they're making a decision which they know is not correct. And the CEO is saying he's not working under any pressure. While he was in the Senate, he actually indicated how this pressure was coming. I do not believe that people of this caliber, knowing what is right, are going to do something that is wrong unless there is a big, big reason they are doing it. So can they really explain to us why they all know as senior management, and they said they have been meeting, that these things they are doing are not really in line with procedures, and they continue to do them? As much as now it looks it's the responsibility just for the CEO. Chair, I'm not convinced they have told us through. Anyone with the 3 of them will say that. Number 2, who is the CEO answerable to? Is the CEO answerable to the ministry or to the board? And at what time does the CEO and the senior management refer a matter to the board? Even if you get an instruction from ministry or from anywhere, there is a board in place. When do they say, let this matter go before the board and the board sanction it? Does that work in that ministry? I think those 2 questions, even the chair can come in and weigh in, because that's where the matter lies. Thank you, Chair.
Professor?
Thank you very much, Chair. I will be very quick on this. I have listened quite much, and my colleagues have actually alluded to a number of things that I wanted to discuss. But having said that, I have got 2 aspects of my questions. Here is to the board, and here is to the management. The chairman of the board, the question I really want to ask is, has Juma ever contacted you, Director Juma? Has he ever contacted you? And has he ever discussed with you of the challenges that he is particularly facing? And if the answer is the affirmative, to the affirmative, what particular actions have you taken? And what have you really done? The next question is about the cumulative term of a CEO in a parastatal and institution is about, it should not be more than 6 years. That's as per the Constitution.
a cumulative of 6 years. That's what I'm saying, which means 3 years and 3 years. How about the procurement staff, particularly the procurement director? What did you do about your position in ensuring that procedures is followed? Who should remain at the helm for how long should they be? As per the law. I also wonder why you have done. You were also privy, and if you are not, you will tell us, Chairman. Why did you commit to such amount of 3.5 or whatever billion that you were mentioning? More than the budgeted amounts for commitments, because the management directly works under you. You are responsible for the funding, budgeting, and planning, procurement planning, for that matter. You have even told us about your budgeting planning initially for the June 2020. Now, Chairman, in my final question, is there any sort of an atom, may it be, of responsibility you should take on the issues raised in KEMSA? And why should you not tell us why you shouldn't take responsibility? The President has cracked the whip, and we're so happy. He has cracked the whip on corruption. 21 days is not far off for it to end, to elapse. My final question is not to you, but to the management now. The suspended CEO, we want to know the funds held between UHC and COVID-19. And I really want to make a serious discussion at a later time in our committee meetings on the issue between the thin line between UHC and the COVID-19. Many of the questions that I would have raised and assertions I would have put were done yesterday. But coming back to Juma, Director Juma, procurement starts and ends at, with you. It does start and end with you. You argued that you were within the law as per Public Procurement Act 2015, Section 2A or B. Fine, that is fine. But was this minuted by your board and KEMSA staff meetings? And do you have documentations to indicate that you have actually done as per within the regulation? Yes. As per within the Constitution? Yes. But has there been discussions and minutes done to the board and, being given the green light to do what you wanted to do? Honorable Jagagwa has mentioned that you have signed all these procurement documents. Why do you wish away responsibilities over it? And my final point of thing is about the acting CEO. How prepared are you for the challenging task to regain the great glory of KEMSA? The public is looking at you. Are you prepared for it? If you're not, you better tell us. Thank you.
Thank you. I'd request that we have the response. A lot of questions go directly to Juma because we had also ready to do the submission. There were questions that were raised. And the person also in charge of the PS at the board of KEMSA. So I'll go to Juma first. I will allow the chair, then the CEO. Let me do it again. Juma, CEO, then chair, and then I'll go to Muridi. And do you have your legal person here, chair? Who is the legal person? Do you have a legal person, acting CEO?
Yes, Fred Wanyonyi. He is not here.
He is not here?
Yes.
Okay. Finance?
Chair, I'm the representative of the PS in the bond.
Okay. Do we have your finance person? Okay, fine, thank you. So Juma?
Thank you, Honorable Madam Chair. The first question which was asked by Honorable Kutunyi is that when issuing this advisory or opinion, and it was disregarded, what did I do? My responsibility is that I report to the Chief Executive Officer, who is my supervisor, and I have a responsibility to advise on matters of procurement. That's what the law requires me to do. And therefore, when these procurements were ongoing, when we reached 3.9, we had not broken the law, we had not surpassed the budget, and therefore, this advisory was not mischievous. I was advising, informing the senior management that we had reached 3.9 billion, and therefore, in my own thinking, we should be able to stop because the letters of commitment which had been issued out were adequate to obtain the items which were required. And also I want to bring to the attention of the honorable members that all the commitment letters which were issued to the suppliers were signed by the Chief Executive Officer. None of them was signed by the Director of Procurement. And I remember in one meeting which the chair was there, and the CEO, myself, and the Director of Commercial Services, the chairman alluded to the fact that all commitment letters should only be signed by the Chief Executive Officer. And that's what we adhere to. So there's no commitment letter issued to any supplier for COVID-19 which was signed by the Director of Procurement. And therefore, my actions in making advisory was to inform the senior management of the risk of going above the budget and therefore breaking the law. So it was not mischievous. The other question which was asked was that by Honorable Jagagwa, direct procurement was, it seems, was mysterious. And I want to report that just indicated that when this procurement for COVID-19 began, it was agreed by the senior management that the procurement of this item will be done from suppliers who will have indicated they will be able to supply this item to KEMSA, as the CEO had indicated. And therefore, all the Indian letters were addressed to the Chief Executive Officer, marked to me for just drafting the letters, and the signing was done by the CEO. So not one time did I act on my own violation. So all commitment to the suppliers were authorized by the Chief Executive Officer. And Honorable Chagaga also brought the issue of a supplier, the name Rigwell Freighters Limited, knowing that their nature of business was clearing and forwarding. Why did I award this supplier to supply 6,000 packets of face masks? And I want to indicate that the Rigwell Suppliers was one of the commitment letters which was issued by the CEO. It was not issued by procurement. So this is an authority which was given by the accounting officer, and I could not be able to veto it, because an accounting officer is responsible for all procurements in KEMSA. So he's the one who issued these letters. It was not issued by procurement. The drafting and its preparation was prepared not in procurement. And therefore, I may not be able to respond to why the CEO awarded or gave Rigwell Freighters to supply this item, because he's the one who authorized them to supply this item. He's one of the suppliers whom the CEO authorized to supply the item. He might have been having some valid reasons. The other question which...
Nursing Services, Dr. Mary. Ladies and gentlemen, it's a great honor for Homabay County that the whole world is watching the briefs of the Minister of Health being made in Homabay. I wish to take the opportunity to thank the Ministry for deciding to come to Homabay today. It's a pleasure. We want to encourage them to come often, so that they can make Homabay home away from home. We want to assure them that we will be ready for them anytime they want to come. At this moment in time, I don't want to talk much. I will talk later. I want to give our chief guest the opportunity to give us the briefing today. Thank you.
Okay. Thank you very much, Your Excellency, Governor. Good afternoon, members of the press, and welcome to our COVID-19 briefing. As His Excellency has said, it's a pleasure to be here in Homabay County, and I want to take this opportunity to thank the leadership, entire leadership of the county and the commissioner's team in welcoming us warmly and engaging us and taking us around most of the day to show us the health facilities. Your Excellency, the Cabinet Secretary sends his greetings to the people of Homabay, and also his apology for not having been here when he was expected here. But we are here to redeem that, and that is why we are here today with you. I am delighted to be here today in this great county of Homabay as part of my countrywide visits to assess the level of preparedness in our counties with regard to the coronavirus disease. From the outset, I want to express my appreciation to the County Governor, Cyprian Awiti, and his entire team for the warm welcome accorded to me and my entourage from the Ministry of Health. For this, I'm very grateful. Thank you very much. This visit had been planned to take place about 2 months ago, but due to unavoidable circumstances, it had to be postponed. I am sure the county team at the time was ready for us, but for reasons beyond our control, we had to defer this visit. That meant we have a debt with the people of Homabay. However, that day has come, and I'm glad we're here today to repay that debt. I'm duly informed that since the COVID-19 pandemic struck our country in March this year, Homabay County government has progressively upscaled its level of preparedness and put in place response measures to combat the pandemic. This morning, after I launched the malaria first-line therapy for the county, I was very impressed with the works that have been done at Malela and Nyagoro COVID-19 isolation centers when I visited with my team. Despite the low numbers of COVID-19 in the county, I am convinced that the county is more than well prepared to combat this virus. In terms of the level of preparedness, I am further informed that so far the county government has trained 1,310 health workers on COVID-19 case management. Further, a total of 2,817 community health volunteers have also been trained, while another 600 are under the home-based care program. In line with the presidential directive, the county has also put in place 317 beds that are ready for occupation by COVID-19 patients. There are also 10 ICU beds for management of severe cases of COVID-19 and 8 HDU beds. I'm informed that the county government has procured and distributed personal protective equipment, or PPEs, for health workers during this case management, for case management. This is very impressive because our healthcare workers, as we repeatedly say, are our frontline soldiers, and we must protect them before they can be able to take care of the people. The county has 9 isolation centers located at Malela, Palakoguta, Kisegi, Tomboya, Kandiege, Nyagoro, and Obera, and Nyangiela. There is also an established incident command center with a functional structure, as well as 8 rapid response teams are in place for the 8 sub-counties. I want to commend the leadership of Homabay County, and especially in the area of health, for having put up this elaborate response structure within the county to deal with the COVID-19 pandemic. In terms of recruitment of healthcare workers, I'm informed that the county has already engaged 69 interns, while the recruitment of 183 health workers under the Universal Health Coverage Program has already been concluded. The workers, I'm told, have already been deployed to primary healthcare facilities, while the County Service Public Board is recruiting a further 165 healthcare workers on contract. The COVID-19 came with its share of challenges, since this is a disease that is as mysterious as it is invisible. I am sure Homabay County has equally encountered various challenges as it strives to curtail the spread of this deadly virus. However, what we can advise you from the Ministry of Health is that it is important first for Kenyans to take individual and personal responsibility in fighting this disease. This is a fight that each and every one of us as Kenyans must partake in order to defeat it. We must continue to maintain standards of hygiene, both in our households and in our workplaces. And we must continue to observe those key measures that have become so common now: hand washing, use of sanitizers, physical distancing, social distancing, wearing of masks. All those measures are still in place, and we need to observe that. It is only when we see our circumstances changing that we are likely to see a progression towards normality again. Homabay was among the first counties that recorded a COVID-19 case, which was imported from Nairobi. From our data, Homabay currently has recorded 62 confirmed cases. And in the lineup of counties, it ranks number 33 in order of decreasing number of cases amongst our 47 counties. That, I think, is a good place to be, I would say. Whereas this is commendable compared to other counties with more cases, there is need for the people of Homabay County to continue observing the measures we have been advocating. To repeat it again, this includes washing of hands with soap and water, maintaining of social and physical distance, wearing of face masks at all times in public places, and avoiding all forms of gathering, be they social or political. The President, in his last address on COVID, did indeed talk about relaxing the numbers for certain particular types of gatherings. But most gatherings are still prohibited, and our appeal is that, as Kenyans, let us avoid as much as possible all public gatherings. Turning to our COVID-19 statistics for today, 212 people have tested positive after testing 3,937 samples over the last 24 hours. Our cumulative number of tests now stand at 463,499. A lot has been said about our level of testing, but I think we need to appreciate that we have done quite well in reaching this number. I know that in the early stages of discussion, and we had discussions for the Africa region through the AU and the Africa CDC And I remember at that time the target that Africa CDC was setting for testing for African nations was 1% of the population, which in our case is around 500,000. So we are very close to that target. Of course, that target may have changed over time because of the spread of the virus, but we will continue within the capacities and resources that we have, sometimes limited by availability of reagents. We will continue to ramp up our testing and be able to identify all those that may be exposed to this virus. From the cases, all are Kenyans, except 14 who are foreigners. In terms of age, the youngest one is a 1-month-old infant, while the oldest is 76 years. We have seen and continue to see, not only in our country but across the globe, that there is a skew in gender in terms of those who are affected. And these 212 who tested positive, 132 of them are male and 80 are females. The distribution of the cases by counties is as follows. And I think you will be happy to note that Homabay is not among these. We had 96 cases from Nairobi, 21 from Mombasa, Busia 10, Kiambu 11, Uasin Gishu 9, Laikipia 9, Taita Taveta 8, Narok 8, Machakos 7, Nakuru 7, Kilifi 6, Lamu 6, Kajiado 4, Bomet 2, Bungoma 1, Kericho 1, Kwale 1, Migori, Muranga, Nyeri, West Pokot, and Meru 1 each. Nairobi has always been one of the hotspots with the greatest number of cases, positive cases. The 96 cases that we are reporting over the last 24 hours in Nairobi are from Dagoretti North and Westlands, 18 cases each, Kamkunji 10, Langata 6, Embakasi West 5, Makadara, Roysambu, and Starehe 4 cases each, Dagoretti South, Embakasi East, Embakasi North, Embakasi South, Kibra, Madare, and Ruaraka 3 cases each. Mombasa is also has been a hot spot in the past, but things are beginning to normalize there. It reported 21 cases, 7 from Changamwe, 5 Nyali, 4 from Jomvu and Vita, and 1 from Likoni. Busia's 10 cases are in Teso North 5, Matayos 3, and Teso South 2. In Kiambu, 11 cases are from Thika 3, Kabete and Kikuyu 2 cases each, Juja, Kiamba, Kiambu Town, and Ruiru 1 case each. The rest of the breakdown of counties in terms of cases is in this document, which will be shared with members of the press. I am happy to inform you that today 195 patients have recovered from the disease. 141 of these were discharged from the home-based care program, and 54 were discharged from various health facilities where they were receiving care. So our total recoveries has now moved to 20,644. And at this point, I want to take this opportunity once again to extend our appreciation and thanks to our healthcare workers who have worked diligently to get us to this point. Sadly also, we lost 4 patients, bringing our fatality to 585. Our condolences to the family and friends of those who have lost their loved ones. Finally, I want to express our appreciation once again to the people of Homabay County, led by Governor Cyprian Awiti, for the warm welcome and hospitality that we have received. We continue to appeal to you to employ all measures to combat this disease so that our people can resume their normal lives as soon as possible. Asanteni.
Very good.
So, Your Excellency, we always like to come and take care of our counties when we visit them. We had organized to come with some PPEs for you, your county. Tomorrow we are going to be in Bomet, as well as Bomet. Unfortunately, there were some logistical mix-ups, but those PPEs have not arrived. But I will assure you that you shall receive as a county the PPEs that we had earmarked for you to be donated on this occasion. And we expect that that should come in good time. Okay. Thank you.
My name is Achola Simon. I work for Kenya Broadcasting Corporation. Initial projections were that the month of September going into December, we're supposed to be seeing the worst of this COVID-19 in the country. But all of a sudden, things seem to be flattening. What has changed all of a sudden? And then, two, in Busia, there's been cries that the truck drivers are being told to pay before they actually tested, despite pay in Uganda. Probably, what is your comment about the same?
Okay. Thank you, Achola. You know, in the early stages of this pandemic, when we did not have a lot of information and data to make more accurate predictions, certain predictions were made. You know, these things are done through predictions using models that use some level of data and estimates. And I know that we had said at some point that our peak was supposed to come somewhat little earlier. Our data later on showed that we may be experiencing a peak, and we have said it between late July, August, September. I don't recall that we had said that we would have a peak between September and December. But even if we did that, then that might have been based on earlier projections. Where we are now, we are exercising cautious optimism because indeed we have seen that over the last week or more, we are seeing what is called the positivity rate, or the number of people who test positive out of a certain number. So in terms of percentage, it means the number of people who turn positive out of every 100 people that are tested. That figure, that statistic, seems to be taking a downward turn, but it is still fluctuating. According to what the World Health Organization recommends, in terms of defining where your peak, or you are at a peak or you have flattened it, is that your positivity rate must be under 5% for 2 weeks consistently. For 2 weeks before you can say that, well, something is happening here. Maybe we are reaching, flattening the peak. I want you to recall also when His Excellency gave his brief earlier last week, there was caution that he expressed, saying that we know that these curves may reach a certain point, an inflection point where then they could either go up or down. That is why we are cautiously optimistic that perhaps ours will come down. So what I want to say is that with what we are seeing, we think we are moving in a good direction, but we need to exercise caution. We need to continue observing all the measures that were put in place so that we sustain that position and maybe even drive it to the direction that we want it to move to. The truck driver story in Busia, I have seen that also on the news. The information that we are gathering from the news is that that snarl-up is a result of the Ugandan authorities bringing in a new arrangement where drivers entering Uganda through the Busia-Malaba borders are required to take a test, a COVID-19 test, for which they pay a certain amount, regardless of whether they already hold a certificate from the Kenyan side. This is a story that has developed, and I'm sure that our East African Community Ministry that is charged with relationships between the East African Community states is on top of this and having discussions. There was an agreement between the East African Community states that provided every country was doing the agreed upon testing and issuing a certificate, COVID-19 free certificate. Those certificates would be honored across borders. So something may have happened to move Uganda to that position. We shall be able to know in due time what the issues are, and I'm sure that there will be discussion and dialogue. From time to time, these COVID-19 testing and clearance procedures have created some level of discordancy between our neighboring countries. If you recall, also we had issues at one point with Tanzania, but these are matters that require a diplomatic approach and discussions to be able to solve them. And I'm sure that the government is on it to try to discuss and see how we can get through this problem, because nobody desires to have their cargo held up for so many days. Some of these cargo is perishable. At the same time, when drivers are held up, the risks of transmission are also high. The cost of trade becomes very high, and this is not something that any country would want to see. So let's say that we will see how those engagements and discussions will turn out to clear this problem that we are facing right now. I want to thank you, but I want to also now, I think, to give back the podium to our host, the governor, because I'm sure he had said earlier he wanted to say certain things.
Yes. Thank you very much, our chief guest. Once again, I want to register our appreciation and our gratitude to the Minister of Health for finding a day, today, 3rd September 2020, to come to Homabay to see for themselves the state of preparedness that this country has gone through. I want to thank you once again, because you have seen for yourself the isolation centers. Unfortunately, you could not have enough time to go around and see the nine of them. But the examples you have seen and the samples you have seen tells you the rest are like that, and maybe better. So really, we are prepared properly for this pandemic. Secondly, you have been able to go through our referral hospital here. I also want to thank you so much for finding time to go through. I'm sure you've seen about 5 theaters we have got in this place. This place was established many years ago by a man called Tom Boyer, and we have done a bit of work on it. There's more to be done. However, today, we also have the opportunity for you to see for yourself the state-of-the-art ICU that we have built in a very short time during this COVID period. And therefore, my request, my humble request to you and to the ministry, that Homabay Hospital, being the first hospital in southern Nyanza, and has served so many people, and we have done a lot of work on it. The mess equipments are working, and thanks to our dear health workers who have also worked very hard with us, save for small issues that we have been able to sort out with them, which will not happen again, I can assure you. We want to request the ministry to consider Homabay Hospital to be a level 5 hospital. Because we deserve it now, we have done what it takes to be a level 5, and I'm happy you have been accompanied by the technical man, the chief medical advisor to the country, the Director General, Dr. Patrick Amoth, who has also been able to see for himself what we have been able to do. And I'm putting this as a request that it will go a long way in helping us to improve this facility. As you know, when you are level 5, you are also entitled to about 300 million in a year. That will help us to expand this facility to become a world-class facility so that it can be able to serve the southern Nyanza. And again, we are also endowed with a lot of islands within Homabay County. And therefore, taking our people to Kisumu or Kisii is very far given the kind of terrain we are having in Homabay. Therefore, my request, and again my request, we had put this across to the CS. We are now putting it to you to send it to be considered alongside any consideration to be done that Homabay Hospital, once started by Tom Boyer, can now be a level 5 hospital. Thank you so much for this one.
Thank you, Your Excellency. And indeed, I think this is an historic institution because it is etched in our history. Since you have mentioned it, it is on the table. You have said that the CS, you have put this request to the CS. It's a matter that is under discussion. But with your permission, if you will allow me, let me ask the technical men to say one or two words, perhaps in this area, in response to this.
Thank you, CAS, Excellency Governor, Excellency Deputy Governor, CEC, Professor Muga. Before I respond to that, maybe let me also just add my voice to the issue that was raised by the journalist. I want to affirm to the nation and the people of Homabay that if you look at the evolution of this pandemic, it is going exactly as had been predicted by the technocrats in the Ministry of Health, together with our modeling team from the University of Nairobi and Jomo Kenyatta University of Agriculture and Technology. Remember even the way we marked the hotspots, how the Busias of this world, Mombasa, Kajiado, Kisumu, Migori, were picked out as hotspots. If you look at the figures, it tells you exactly that what had been predicted is what is obtaining us today. We also told you that the first case will come through a port of entry, and we picked Jomo Kenyatta International Airport, and probably would be asymptomatic, would go to the community, develop symptoms, and would come to a health facility, therefore exposing very many people. Again, that scenario is exactly what we dealt with the index case 1. For Homabay County, because we are dealing with sporadic cases, as at now, Your Excellency, and Waziri and Excellency Deputy Governor, is to appeal to you to support the sub-county health management teams to be able to ensure that we have heightened level of surveillance, especially at the community level, using your very strong community health services through the community health volunteers, so that we can be able to pick these cases as soon as they develop. And then based on that, we do a quick contact tracing, which because of your low case load, you should be able to do 100% contact tracing. Take the necessary action, including isolating them and also testing. We have seen your state-of-the-art laboratory with the Waziri, and I think you deserve to be a COVID testing center. And there's something that the ministry is working on very soon. Based on your ISO certification, then you'll be given top priority. Regarding the upgrading of the facility, yes, we have gone through the facility. It meets the criteria for a level 5 hospital. I've talked to Dr. Como and the CEO, Dr. Kochola, who was my colleague in the ministry. Let's do the letter plus a concept note. Then we are in the process of gazetting other facilities so that we don't do it piecemeal. We do one gazette notice for elevation of hostels that meet that specific criteria. Once again, I want to thank you for the good work that you have done, not only in COVID, but also in the area of malaria, in the area of HIV. And finally is to appeal to you to ensure that the essential services continue, maternal, newborn, child health, including immunization services, family planning services, delivery services should continue, HIV, TB care, non-communicable services should continue, and all other services, because we are making progress. Let's not lose our cool. Let's hold our hands together until we reach the magical 5% for the next 2 weeks. And together, if we hold hands, we should be able to achieve this within this window period of 30 days that His Excellency the President gave us from 1 or 2 weeks ago. Thank you.
Okay.
Thank you.
Good. I think we are coming to the end of it. I want to thank everybody, members of the Fourth Estate. I want to sincerely register our appreciation for the journey you have been able to walk with us. It was a long journey, very long journey. We have really been walking a long journey, and we, at the end of the day, it is here. There have been doubting Thomases. People don't believe that we have done it. We have done it. You have had it today. Those who have been doubting as to whether we have got an ICU, you will be opened and you can walk in if you want to see for yourself what has been done. One of the best ICU, better than Aga Khan, I can assure you. Dr. Patrick Amoth will confirm that later. We also have a functional blood bank, which is here. So really, I want to confirm and concur with the Director of Medical Services, or Director General. Indeed, we meet the requirements of our level 5. Indeed, we do. I think we just need to, put up a nice, good proposal, which Professor Muga, being a professor, with this team of Dr. Como and the rest, will be able to put that very well to the ministry. And having been sitting in that ministry many years ago, she'll be able to know the language, the commerce, and what issues need to be done, so that at the end of the day, we get the hospital upgraded to level 5. Lastly, I also want to thank my team and the partners we have worked with. Without the partners, ladies and gentlemen, we would have not been what we are today. This has been what we call a multi-sectoral approach to be able to reach where we have reached. For the interest of the people, we also want to thank His Excellency, the President of this country. The leadership he has been able to provide on COVID is beyond reproach. We want to say thank you very much, Your Excellency. You have inspired us to do what you have done in Homabay. You really worked very hard. You put people together. You have put all shades of leaders together so that this thing can be addressed. And indeed, your choice of the people in Ministry of Health cannot go without being commented. Mr. Mutai Kagwe, better known by children as the Corona Man. You see, really, he has done a good job with his team. With Dr. Rashid Man and Dr. Mercy Mwagangi. And of course, with the technical support they have got from Dr. Patrick Amoth and Dr. Mary. Indeed, we feel very proud of you. Kenyans are very strange. When people do a good job, they must look for some dirt on them. That's the unfortunate part with the Kenyans. These people have done an excellent job. Yeah. This thing came at a time, it is a third world war that came to this country. And therefore, we needed people like the likes of Mutai Kagwe, the likes of Dr. Rashid Ahmed, Dr. Mercy Muganga, and of course Dr. Amo. But he could do this kind of a job. Really. Yeah, we want to thank His Excellency for the choice of the people he put at the Ministry of Health. And we want to encourage him to have these people, because without these people giving us briefs and also being able to monitor this thing very closely and coordinate it, believe you me, ladies and gentlemen, we would not know where we are today. So thank you very much, Your Excellency Uhuru Kenyatta, for the good job you have done to this country and your team. I also want to thank my own team in Homabay with Homabay. I also want to thank our team in Homabay for the excellent job they have done. We had a very important committee which was chaired by a corporate member of this county and other eminent persons. We also want to thank the county commissioner with his team, the incoming and the outgoing, and the security team. Without this, Dr. Amoth, this kind of incident management committee and the surveillance that you have mounted around and the contact tracing would have not been achieved. So really, I want to thank these people. We have really done very well. We have brought all the leadership together, be it assembly leadership, be it members of parliament, be it different partners, water partners, agriculture partners, health partners. We have been meeting continuously and working on this thing very well. So thank you so much. This has really been here, but we are not complacent yet. We are just starting. I can assure you, Dr. Rashid, go back with a very important message. Homabay is just starting, because you have taken His Excellency the President very serious. That when the curve is trying to flatten, don't laugh. It can also disappoint you sometimes. It has done that in many other countries. So we are committed and we are serious. Lastly, health workers. These are very important people. You are very important people, I can tell you. And
Bwana CEO, could you give us a time frame? Could you give us a time frame when this issue is going to be concluded? Is it tomorrow you're concluding it, and when are we getting the mask to the public?
Allow me to communicate officially to your office tomorrow.
At what time tomorrow?
Tomorrow morning.
You want to see you, since you took over that seat, you've been trying to be very elusive. Very elusive. You know, you try to be gaugy. And you know, we've been around for long, so we know people who can take the committee round. So be very careful we don't categorize you as a very elusive, as someone who appears to the committee in a very clever way. So be very careful. What we are saying is that we don't want to be communicated tomorrow. You know very well. What are you discussing tomorrow? And if it is an issue of conclusion, you know how many days? 14 days? Is it 10 days? Yeah.
Honorable Member, Madam Chair, we are meeting in chamber tomorrow morning. I'll communicate immediately thereafter.
And I hope in your communication we have timelines on when we expect these masks to go out to vulnerable Kenyans.
It will have dates of delivery dates when we expect the first batch.
Very good. And Chair, you can now make your comments as you conclude. And also, Chair, just tell us about that, the 300 million. If you want to add a voice on that, proceed.
Oh, thank you very much, Madam Chair. The questions that were raised, or issues that were raised with me, are not many, and most of the other issues have been answered too. Honorable Wino asked a question, who is supposed to sign the commitment letters, and I believe that has been answered, that the procurement person, and then they were signed by the CEO after they had gone through the process. Dr. Nyikal asked to whom is the CEO answerable, and the CEO is answerable to the board. Now, I was asked, why did we send Mr. Murithi on suspension? That was coming from Honorable Jagagwa, who has since left. And the issue was, why did we send him on suspension, and yet he was not in the list involving procurement? Let me put it this way, that, like I've said, there are investigations going on. I've read out to you the letter from EACC. It is actually in the volume 1 folder of file that I gave out when I was here last, I think it was last week. And the investigations are going on. Now, Honorable Jagagwa would say that, that Mr. Eliud Murithi has nothing to do with the procurement. I may think so too, but the investigations are ongoing, and once we get the answers to them, like I said candidly earlier on, what will happen then to Mr. Eliud Murithi, Mr. Charles Juma, and to Dr. Manjari would depend very much on the results of the investigations that are going on. But I do not think it would be good at this time for me or for anybody else to try to preempt the investigations that are currently going on. Honorable Professor asked me whether Mr. Juma did get to me directly. What happened, they have mentioned to you, the 3 directors who confirmed to you, in fact, all the directors who confirmed to you, that I was sitting with them at the commencement of this COVID thing. And I told them that, listen, you have told me it's going to be emergency procurement. You are going to do procurement as an emergency, but I want to tell you one thing. And I told them, and they'll confirm with you, Mr. Juma has confirmed it. I told them to make sure that the procurements were done correctly. That if you ask them one by one, including the finance director who is not on suspension, they'll tell you I communicated that with them. And I told them from my own experience, because I've been a member of parliament, I've been a senator. I told them that in this kind of situation, at the end of it all, I told them you are going to see EACC here, you are going to see DCI here, and you are going to see so many people here, including the Office of the Auditor General, wanting to know what happened, if anything happened. And what I told them is exactly what is happening now. And I said it in good faith, because a lot of money was going to be involved. A lot of money has been involved. Has any money been lost? That is what the investigation is going on now. But I do recall that CS Senator Mutahi Kagwe yesterday said, and I have said it before, that from where I'm sitting, no money has been lost, but we procured these things, which were worth so much money, 7.6 billion shillings, and now we have a stock of 6.2 billion shillings in our warehouse, and that stock is there, and that is why I had invited you, and I still hope that you are going to do it one of these days, come and actually verify that the stock is there. Now, am I going to take responsibility as the chairman of the board? That's a question again. Or before I get there, did Mr. Juma get in touch with me? Yes, he did. He actually did not. I'm the one who got in touch with him, because on 30th of July, I called for a special board meeting to be held on 3rd of August. At this time, KEMSA was under the microscope. It had come so much at the microscope, every news media was talking about KEMSA. We were seeing memos were exchanged between the CEO and the director of procurement. We do not know where the media got them. We were also reading about them, and that's when I asked Mr. Juma to let me know whether indeed those memos were in existence and whether or not he was able to give me the folder. And that discussion and the discussions I had with the CEO, Dr. Manjari, informed the meeting that we had on 3rd of August, at which we were taken through board paper, I believe, number 12, at which we went through the COVID procurements one by one, how much how much we had now reached, and how they thought they were going to fund it. Madam Chairman, let me say this. we are talking about a procurement period of just about 2 months. An emergency procurement period of about 2.5 months, between 15th of March and end of April. You find that no procurements were done after May, except those which were extensions of the periods that had been given. And that's a very short time because the board does not sit every day. We have not had a full board meeting since March. And when we meet again, we are supposed to have met in August. We did not meet because of all these meetings we've been having. We are going to confirm the minutes of the previous meetings, including the special board meetings that we had. So it is not possible that the board was going to be there and see every single letter that was written to every single supplier at KEMSA. All we did, and I want to say this at the risk of repeating myself because I think it is important, Madam Chair, is that we had a procurement plan and we had a budget. Then we had COVID coming in mid-March, 2.5 months to the end of the financial year, and the budget was almost completed. The question that you are going to have to determine, Madam Chair, in the committee, for which I have the greatest respect, is whether or not the management at KEMSA acted prudently to be on the safe side, to have these commodities in place, because nobody had, indeed nobody even now knows how long COVID is going to be lasting. We have stocks worth 6.2 billion shillings. You've said, and that is correct because you represent the people, that people still do not have masks. If we are allowed to offload the stocks that we have, there will be masks. The only question that will be asked, and this is the question we've been asking throughout, is there going to be any marketing, any trade loss? And yes, there's going to be a trade loss. I would like to request this committee to help us save the situation by offloading what we have so that the needs of the Kenya citizens are met, even as we discuss what trading losses there could be because of the market that has shifted pertaining to these commodities. So, am I willing to take responsibility, Honorable Professor? Yes, I'm willing to take responsibility. I'm willing to take responsibility as a chairman of the board. Sure. If it comes to taking responsibility. And I'm not going to pretend that I will take responsibility the moment this thing, it requires me to take responsibility. That I can assure you from where I am sitting.
Chair, very quickly.
Allow him to finish.
If you could allow me to
just
finish,
on that particular
then
point,
you could raise the issues.
Let him finish, kindly.
I want to say this, Madam Chair, that I've been a chairman of the board now for just about a year. And when COVID came, in or about March, we had done a lot of work, both of reforms and others, at KEMSA. We have UHC, and the board met as ought to have met, and I want to assure you, Madam Chair, that this board is very proactive. And we have a relatively new board now. I am just about 1 year. The other 5 members are all of them new, except Dr. Mbuva, who sits as alternate to the PS, and the National Treasury representative of the PS. So we are a relatively new board, and we are very, very committed towards seeing reforms are done in KEMSA. And we are going through a very serious reformation. We're just finalizing our strategic plan, which we have done in conjunction with our global partners. First of all, the GOK, the government, our own government of Kenya, under which we are, and Global Fund and USAID, who are our partners in these matters. So we are not just sitting and watching. And KEMSA has, in the meantime, been growing. Dr. Manjari has told you, as has Mr. Karanja, the finance director, that we've grown from 2.2 billion to 4-point-something billion. That is growth. Then as we were settling in to deal with the reformation, COVID happened in or about March. And now it has just been about COVID since March. And the months of procurement were only those 2 months, 2.5 months of April and May actually, because there were no procurements in March, at least not much of them. So we have not been sitting back and watching. We have had meetings, and we know what is going on. But we as a board gave the management and told them this: you have to be prepared because of this COVID thing that has come now. And that one, I accept, the board told them to be prepared. Did we approve a bigger budget? No, we did not. No, we did not. There was no supplementary budget. Indeed, when we had board paper number 13, at which we were requested to allow an over-expenditure of 3.6 billion shillings to meet the liabilities because of the COVID-19 over-expenditure, the board declined to give that authority because, one, we needed to have a proper explanation, and two, because investigations were already going on and it did not want to deal with figures that then somebody would say we're interfering with the investigations. So, Madam Chair, this board that I chair is a board that is willing to take responsibility should it be found that we have done anything outside the mandate of ourselves as the board. I came here last time. I took you through all the documents, and we did it candidly. And now I'm asking you, as a committee of health, which is seized of this matter, and which will be able to make a decision on the matters that we have put before you. I'm asking you to look into the issues and recommend that we should dispose of the commodities that we are having for 6.2 billion shillings. A trade laws will be made, but in the meantime, those masks, those PPEs, and all those other things will be out there serving the citizens of Kenya who need them. I want you to understand, like I tried to make you to understand last time, that we cannot be able to sell those PPEs, etc., for the amounts of money we bought them for at that time because the market has shifted. And I challenged you, because you're honorable members, to confirm to me that when you bought a K95 in March or April, you bought it for between 900 and 1,200 shillings. Today, you can get it for 400 shillings. But this is today, and that was then. Did we act prudently? I dare say there was prudence. Did we make a mistake? Let this committee decide whether a mistake was made. Was the board fully seized of the issues? Yes, the board was fully seized of the issues, but the procurement period was between a very short time, and the board does not meet every day because we do not micromanage management. We allow management to do what is right in good faith, keeping prepared, but knowing that there is a budget. So those are issues that are very important. Madam Chair, I want to say this as I conclude, that you and the committee may not appreciate just how much we appreciate the work that you are doing. Because before you started doing your investigations in committee, the sensationalization out there was unbelievable. How we stole Jack Ma, how we stole this, how we overpriced, how we did all these things, Madam Chair. But since you started sitting and there has been this open forum with the media, sometimes live, sometimes reported, even if there's a distortion, sometimes, at least, Madam Chair, this committee has saved a lot because there now cannot be business as usual of sensationalization, of showing that there is a dispute between management and the board, or the board and our mother ministry, Ministry of Health, because there isn't at all. There isn't. We are trying to do what is right. And I want to promise you this, that this board is doing what is right. And your committee has helped us a lot in bringing out and disabusing the notion that we are thieves and vagabonds sitting at KEMSA and allowing things to be stolen from KEMSA, including donations, that we are insensitive because they are there when people are dying. We have been candid with you, and you've been fair to us. And all we are asking you is this: let us finish this thing and let Kenyans know the truth, so that when you compile your report, like I believe it will be a fair and balanced report and taking into account the situation that we are in. Madam Chair, we are going through reforms at KEMSA. And KEMSA is still gold standard. KEMSA still has the quality. We have one of the best quality assurance laboratories. And when you hear that a PPE out there is not working, then it was most likely not procured through KEMSA, because if it was, we take it back and we collect the whole of that consignment and we take them back to the person who supplied it to us. So when you hear about quality, everybody knows that even the farms and non-farms that we deal with are of the highest efficacy. Madam Chair, we have had very many meetings since end of August, since July and the supervening period, because even us want to go to the bottom of the matter. There is no happiness in me, Madam Chair, with my senior directors, Director Muriithi, Director Juma, and the CEO suspended. We did not suspend them, Madam Chair, because we had done investigations ourselves, but at the advice of EACC, which is an arm of this government, and which has stated out the law, under which they requested us to do the suspensions. We did that because we do not want it to appear in the list that there is anything we are hiding, because there is nothing we are hiding. And if Kenyans appreciate through this honorable committee that the prices of April are not the prices of August and September, then people will start understanding why we are holding a stock at KEMSA and why we are asking this committee to help us by making a recommendation that we offload that consignment so that, one, Kenyans have the commodities, and two, that we count the losses. I end by saying this, Madam Chair. It is not for us or for me as the chairman of the board to say that there was overpricing. The fact remains that we have supplies in our warehouse. If that person has a commitment letter telling them to supply PPEs at this price within this period, and that person in compliance supplied those PPEs and they're in our warehouse, we signed a delivery note, then we shall be asked to pay that money. We are standing at 2.9 billion shillings of unpaid debt, Madam Chair. 2.9 billion shillings is a lot of money. We will pay. If we are taken to court to pay that money and we are found to have been liable, we will be talking about 3 billion, 4 billion, 5 billion shillings by the time this ends. In other words, we shall be digging a hole when we are already in a hole. That is where we are asking for your assistance. One other assistance I want to ask from you, I don't know whether this is the correct forum, is that we are owed in excess of 2.5 billion shillings by counties. 2.5 billion shillings by county, and that's a lot of money. If we had that money, and because the law says they must buy from us, and they know we shall ask them to pay their debts before we supply them, they'll go and buy out there, instead of coming to KEMSA to buy from us. So, Madam Chair, we are in a vicious circle, and only this committee is going to help us to get out of that circle. We don't want to continue digging when you're in the hole, and you can help us by giving us a ladder to get out of the hole. Those are my submissions, Madam Chair. And I want to thank you very much for the opportunity that you have given us on these COVID-19 issues. Thank you.
Thank you, Chair. I want members, anyone with a comment and a brief one, comment. No more questions.
Yes.
I think we've had enough. Just comment 30 seconds each so that we can proceed. The other team has been waiting for the last 2 hours. So I'll start with the professor, then I'll come to Dr. Nyikal, and that's it. Those are the hands I saw.
Thank you very much, Chair. Chair Lady. Thank you very much, Chairman. And I really liked your bold position to say you will take the bullet by the face, not by the back. So not while you're running away, but while you're facing the actual bullet. So that's fine. That is acceptable, and you are responding to my question on that particular aspect, and I take that as I take the opportunity to acknowledge that. But one thing that is important is when we write our report, we will definitely consider your pleas and all that, but we will definitely stand at the fair line and deliver that. Thank you very much. My
simple for the executive, particularly the CEO. Please always inform and consult the board. It does not matter where instructions and letters have come from. Let the board also own it. If we go like that, we will not find ourselves in a situation like this again, hopefully, where we spend so much time on something that we should get over with quickly and give services to Kenyans. Thank you.
Quick one. It would be helpful, Chair, if we get a distribution list of these 5 billion UHC, all those counties which have been doing the withdrawals, how that plays with the donations, which they are also receiving. I'm just curious, could be there's some double dipping here, but if we could get that list, that would be very helpful to this committee as well.
Vice Chair.
Madam Chair, thank you. Madam Chair, I don't want to discuss what already has been discussed. We have enough information. We've asked a lot of questions. But Madam Chair, allow me before we go to the next session to raise an issue concerning this document that was tabled here in the morning. These are JAGMA donations, the JAGMA donations that came to Africa. Madam Chair, if you go through the list where Ethiopia, the country which was handling these items, all African countries, they were getting swaps. The rest, 18,900, extraction kits, 18,000. But when we come to medical disposable protective clothing, whereas Kenya was getting 3,790, and the rest of the African countries were getting also 3,790. Ethiopia got 7,610. Ventilations, face shield machines. Whereas the rest of African countries were getting 3,800. Ethiopia was giving itself 7,600. Thermometer guns, whereas the rest of African countries, including Kenya, was getting 15 packs. Ethiopia was giving itself 100. Medics gloves, whereas the rest of African countries were getting 36. Ethiopia was taking 128.
What's your point, Vice Chair?
My point, all this raises a lot of concern. This is where perhaps maybe our equipments and the ventilator, 21 items got lost. Maybe they decided to open and take from other African countries, including Kenya. So I think Jack Ma must be informed wherever he is that he trusted the wrong country.
Honorable Kutuni, you know, we have very good relationships with Ethiopia, and we don't want to open a diplomacy row here. So let's leave the matter at that. We can raise the matter with the Ministry of Health, and I know they are following up on that matter. But anyway, thank you very much. Thank you, Chair, and your team. Thank you for the submissions and also being very bold and open. I think we have had a good conversation, but clearly, Chair, as even if you say some things were done in the media, there is some disconnect amongst your managers, or I don't know what to call them. You can see clearly there is some disconnect. So you might need to work on your team to make sure that there is no fighting, and maybe establish the cause of the fight. If it's possible, manage it, because once there is infighting and people are fighting, then for sure we'll have these stories coming on, and people will not have good working relationship. Number two, your board needs to be more firm. We understand, yes, you don't run the board every day, you are not at KEMSA, but we might need some reforms so that there is clear communication between what the management is doing, so that the management don't run their own show, and when things are tough, then they come running to the board. That's when you'll know when things have gone south. So clearly, you need to have reforms. Number three, I think the issue of ICT, I don't know where we are with KEMSA, but we need now to be very open. And the President gave us a directive, and so acting CEO and the Chair will be holding you responsible to see how fast you adopt the best practices with ICT, so that if there is a tender coming up, whether direct, whether it's the normal tendering process, it's open out there. Because sometimes the whole of this issue, people are feeling, I may have been a supplier, or I may have loved to come and supply, but I didn't know this was happening at KEMSA until the scandal has come. So transparency is key, so that we are not hiding any information. And again, KEMSA does not become an entity for a few, select few, that only a few companies can support or can supply KEMSA. And so, CEO, I would also wish to know the list of the suppliers who are there. How often do you renew? How often? And that's you don't have to give us now, but those are some of the things that you need to open. Let people who are potential suppliers come to KEMSA and supply. Let it not be a club of a few who can only supply KEMSA. And so you raised an issue about us giving you authority to dispense the items that you have. We may need to, and I don't know who is now in charge of the commercial, we may need to, through the ministry, have an idea. When Kenyatta Hospital came here, they said they have supplies worth 1 year, I think, or PPEs given by Equity Bank. So could we know the gaps that are out there? Because some of them, through the government, they can be taken to those institutions that need. And then, at what point did you stop? Why did you decide to stop selling? Was it because of the prices, and that's what you want us to allow you? And if you're talking about the prices, would be keen, and that's why we need that list, to know how many of these suppliers have you committed to the amount you're charging them, how many have you not even negotiated? And if you are to negotiate, be very open with this committee. At what price will you negotiate? So that we agree. And I know, unfortunately, the prices are going down every day. So will the government go on loss alone, or will it be shared losses? Because we said every other entity, be it the bank, the hotels, the bars are closed, everybody is going on loss. Is it just going to be a burden on the government side, or is it going to be shared? But that also will be advised based on the number of suppliers who have not negotiated yet. So we'll see you kindly. Those documents, hand them over tomorrow morning so that we can be able to finish with these minutes by early next week. We thank you. Have a good afternoon. And may God bless you. Honorable members, unfortunately, today is another day you will not leave. We will only take the health break as we allow the Chamber of Commerce and the suppliers that we had invited before this committee to be ushered in by the Sergeant at Arms. Asanteni. Sergeant at Arms, kindly sanitize quickly so we can go on. And members of Fourth Estate, thank you for just staying. If you get some, at the back there is, I think, milk and some biscuits. Just feel free. We will share. And the one who doesn't have, I have some remaining here. And there's also a packet of milk. to advise that you only sit where there is a mark of seat here. So if where you're seated is the wrong place, kindly look for another place. You can reorganize yourself depending with the organizations you have come from, but due to the COVID regulations, you will be forced to move because there's somebody seated here. There's someone here. Are you sitting there? Okay, yeah, take this seat. We'll start with the Chamber of Commerce. So I will request that the person to do the presentation on behalf of the Chamber of Commerce to take the front seat. And if you have any submission, we request that you just place them on the desk here, the Secretariat to pick them.
Yes, yeah, we have some submissions, so in a few minutes.
Okay. When they come in, they just place them on top of that table. And after the Chamber of Commerce, we will start with Crown Healthcare. Then we'll go to Megascope and finalize with Shop and Buy. Good afternoon. I would like to call the meeting into order. And since we are finally on an afternoon session, allow us to pray. Let us pray. Almighty God, who in your wisdom and goodness have appointed the offices of leaders and parliaments for the welfare of the society and the just government of the people, we beseech you to behold with your abundant favor us, your servants, whom we have been pleased to call to the performance of important trust in this republic. Let your blessings descend upon us here assembled, and grant that we treat and consider all matters that shall come under our deliberation in so just and faithful a manner as to promote your honor and glory and to advance the peace, prosperity, and welfare of our country and of those whose interests you have committed to our charge. Amen. Honorable members and our guests this afternoon, would like to start with the introduction so that we know who we have. Where you are seated, when it's your turn to introduce yourself, you just have to press the mic. And once you are done with the introduction, you again press the place marked mic. I want to start with honorable members. And Honorable Joyce, you can start.
Honorable Chair, thank you. I'm Joyce Emanikor, MP Turkana County and a member of this committee.
I'm James Nikal, Member of Parliament for Seme constituency in Kisumu County, member of this committee.
David Eseli Simiyu, member for Tongaren.
Martin Peters Owino, member of Parliament for Ndewa, Homabay County, and a member of this committee.
Dagala Beatrice, woman MP, Vihiga County, and a member of this committee.
Muriuki Njagagua, member of Parliament, Beira North, and a member of this committee.
Honorable Joshua Khutuni, MP Charangan, Vice Chair of the L Committee.
I'm Sabina Chege. I represent the people of Murang'a at the National Assembly. I chair the Health Committee. We have our Secretariat.
I'm Yodi Emmanuel, Clerk Assistant.
I'm Emmanuel Lepashan, Sergeant at Arms.
Maureen Kweyu, Audio Officer.
Thank you very much. I would like we start the introduction from the team that is representing the Chamber of Commerce.
Thank you very much, Madam Chair, and thank you very much, the honorable members of this committee. My name is Richard Ngatia. I'm the Chamber President I'm here to represent the Kenya National Chamber of Commerce and Industry. And with me, I have a team. We have our company secretary, Kihara Jogona. We also do have our chamber vice president, Dr. Eric Ruto, and we do have the secretariat with us. We also do have a few members from the micro MSMEs who are artisans.
Could they introduce themselves?
Yes, they can.
I just want all those who have been introduced so that we put the name to the face. The team from Chamber of Commerce.
Okay, I can start from my side. My name is Dr. Ruto K. Eric. I'm the Chamber Vice President and also the Chair Health Committee at the Chamber. Thank you.
Good afternoon. My name is Nemaisa Kireni. I head special projects at the Chamber of Commerce Secretariat.
Good afternoon. I'm Kihara Njuguna. I'm the Chamber Secretary. Thank you.
Is that all?
No, we do have some members from the business community.
So where are you? Just press
Good
the mic.
afternoon. My name is Teresia Mwangi, Kenya National Federation of Juakari, and a member of Chamber of Commerce.
Good afternoon. My name is Patricia Mwende, member of Kenya National Chamber of Commerce and Industry. I'm also a member of Chambers of Commerce and a Juakali artisan.
Good morning. Good afternoon. My name is Felix Ndunda, Kenya National Federation of Juakali Youth Officer.
Good afternoon. My name is Jeffrey Wilson from the fashion industry, a member of Kenya National Chambers of Commerce.
Good afternoon. My name is Grace Bogwa, the chairperson of Bunifu Association, a member of Kenya Chamber.
Okay. Anybody else?
Yes. Good afternoon. My name is Catherine Dongo, Ubunifu, member of Chamber of Commerce and Industry.
That's all.
That's all, Chair.
Allow us to first have that introduction. Now, when we come to the companies, you'll be doing the introduction when your time comes in. I think that will be in order so that we allow the Chamber of Commerce. I've seen it's a big team. Once we dispense on your matter, we'll allow you to leave. I just want to give a background on why we are here. And I want to start with the Chamber of Commerce, why you're here. Part of the mandate Part of the mandate of the Committee on Health is to oversight. We actually allocate finances to the Ministry of Health and its agencies, and also we oversight how that money is done or it's used. And so currently, I'm sure you're all aware that there's an issue about COVID-19, and we allocated money. Part of the money we allocated was 300 million, money that was meant to quickly and urgently procure a reusable mask to be given to the vulnerable members of this country. In the submissions from the ministry, from KEMSA, there was a mention that that money, 300 million, a letter was given from the Ministry of Health, giving authority to incur expenditure to KEMSA to procure those masks to the society. I'm sure you live here and you know we have not seen any mask donated by the government as reusable mask. Part of our investigation, we also garnered that Chamber of Commerce was given the responsibility to supply. Would want you give information to this committee on why those, is it true that you are given that duty or responsibility to supply this mask to the vulnerable members of our society? Have you done so? If no, why and where are we in this process? And when do we expect to have distribution of these reusable masks to the vulnerable members of the society? So I'll go back to you, Mr. Gatia, or you will tell us who will do the presentation on your behalf.
Thank you very much, Madam Chair. Honorable members,
I will be doing the presentation of the Kenya National Chamber of Commerce and Industry, and in relation to the partnership between Ministry of Health and the Kenya National Chamber of Commerce and Industry. And therefore, mine is to thank this honorable committee for allowing us to come before you so that we can put things into perspective and so that you may be able to understand the chronology of events. I would also like to take this opportunity to express our gratitude to His Excellency Honorable Uhuru Kenyatta and the Cabinet Secretary for Health, Honorable Mutahi Kagwe, for the support accorded to the local manufacturers in fast-tracking the local manufacturing of PPEs. And as an importer of PPEs, we are very grateful for the policy changes made in this regard. So the members of the Kenya National Chamber of Commerce, particularly the National Governing Council and the Board of Directors, are equally very grateful for this support that we have been accorded. So through this program, we shall support hawkers, tailors, Juakali artisans, women and youth, and all those in fashion industry. And therefore, we are here today to petition through the Honorable Health Committee of the National Assembly to assist in ensuring legitimate and genuine suppliers, some of whom are our members, to get more business and paid on time. And therefore, the Kenya National Chamber of Commerce has been at the forefront in proposing both short-term and long-term measures to support the micro, small, and medium enterprises, particularly at the county level, to continue with their businesses, activities with minimal interruptions and ensure sustainability. And Chair, it is good to note that we have signed an MOU with the Council of Governors so that we can be able to partner and see how we can sustain businesses of both our members and the private sector across the country. So to ensure business remain afloat during this COVID-19 crisis, we have partnered with various organizations and agencies to provide continuous skills and knowledge virtually on enterprise and business continuity, working capital, and agencies to provide all this, and also supply chain management amidst this disruption. So I would want you allow me, Chair, just to give you the chronology of events on the manufacture of reusable face masks under the partnership of the Ministry of Health and Kenya National Chamber of Commerce and Industry. On 23rd June of 2020, we held a joint meeting with the Ministry of Health and the Kenya National Chamber and Industry and the following stakeholders, namely the Kenya National Federation of Juakali Association. We also had with us JLO Collections. We also had Design 365. We had the JW Show Associations, and also the NES Polypack Limited, to name but a few. And therefore, we agreed on some action points, and it was agreed that KNCCI would provide clear outlines for engagement of the different groups in the production process. And also the production capacity of the different groups, production and delivery of schedules, and list of organizations to be engaged. Following that, on 25th June 2020, KNCCI received a letter from the Ministry of Health, which is attached in the document that we have just provided you, Madam Chair. And this is a reference MOH/admin. This is ADM/1/2/16, volume 1, and in brackets 108, which had specifications for reusable face masks. And therefore, KNCCI received specifications for these reusable masks from the ministry, and on 26th June, we presented the Ministry of Health a proposal on the production of face masks for vulnerable populations across the country. And therefore, on 26th June, the ministry received. Again, it is annexed in your document, Madam Chair. And on still the same 26th, KNCCI wrote a letter reference ADM/57 to the Ministry of Health seeking clarification on the initial specifications received due to the following reasons. One, the height dimension of 95 millimeter for teens and adults and 60 millimeter for children who are between 2 to 14 years did not cover the nose and mouth appropriately, and the majority of the samples have come with minimum length. We did recommend increasing these to a minimum of 160 millimeters for teens and adults and 120 millimeters for children between 2 and 14 years. So the synthetic elastomeric material tape of 5 millimeter and 120 millimeters as a minimum does not allow for comfortable fit for teens and adults. So these, our members had a difficult and challenge to, to give samples because it was evident those samples did not meet the specifications required by the public or the users. We recommended a minimum to be set for both age groups, and that of teens and adults be 180 millimeters and children 2 to 14 years be 120 millimeters. On 15th July of 2020, the Chamber sent a letter, reference number ORG, that is ORG/13, to the Kenya National Governing Council leaders of all KNCCI chapters across the country, informing them of the program to support the production and distribution of locally manufactured personal protective equipment, and request each county to generate a list of businesses who local producers of reusable fabric face masks, local business which do embroidery, and 3, local businesses which do fabric screening and printing. And therefore, we as KNCCI received a list of businesses from all our counties through the National Governing Council where they're placed, and we have the chapters in all 47 counties. Then on 16th July 2020, we as KNCCI wrote a letter reference ORG/13 to the Kenya National Governing Council to submit samples, and the submission began on 17th June 2020 from all counties to date. We have received samples from a total of 333 micros, local manufacturers inclusive of the Jua Kali across the country, and the total production of these 333 and their capacity is 1,880,752 masks per day. However, this exercise, Madam Chair, is continuing so that we can get as many members, as many people who would want to participate in this program, and I'm happy that the fourth estate is here. We shall also work in partnership with them so that we can disseminate that information across the country so that we do not leave anybody behind. So to support the production, KNCCI undertook the following. One is KNCCI engaged the fabric manufacturers to support in training to ensure quality services. So that is one of the initiatives that we took ourselves to make sure that also the big players can come and support our members, the micros, and the list that I've just mentioned earlier, Madam Chair. So due diligence was done on the key manufacturers and local producer and manufacturers to purchase materials to subsidized price from the mentioned manufacturers. One, the following fabric manufacturers have responded and provided sample fabrics for production. And again, Madam Chair, these companies are there to support the tailors, the micro, and those in local manufacturing. One, like I said, in capacity building, to, like I say, to make sure they meet the specifications, and to also make sure that they help them in sanitizing those masks before they are delivered. The companies, namely, are Thicker Cloth Mills, we have Sunflag, Rivertex, we do have Kikotech, we do have Betty Investment Limited, and who has also promised to capacity build on pro bono. And under KNCCI, again, we do have a program, and we would love to support our members who will not be able to meet or cannot be able to meet that capacity, so that we can accord them through a program under the MasterCard Foundation. And therefore, the resilience program, KNCCI shall avail seed capital in form of a short-term interest-free loan for any manufacturer who is in need of finances. And this program has begun already. Then on 17th July 2020, Madam Chair, the Kenya National Federation of Jua Kali Association submitted a letter which is reference KNF, JKA, stroke CEO, stroke KNCCI, stroke CP, stroke COVID-19, stroke 7, stroke 20, with a list of 33 manufacturers from the counties. And the sample submission began from the counties on 18th of July 2020. And on 27th of July 2020, KNCCI wrote a letter, reference number admin stroke 32, to Kenya Bureau of Standards to support in the verification of samples received from local manufacturers. Again, we had a meeting with them, and they agreed to partner with the chamber to support this sector. So the first list of companies and samples sent to Kenya Bureau of Standards for verification, and also samples continue to be received to date. And again, on action points, KEMSA at the rate of 50 companies per day delivery starting on 27th. This is when now we started to give the samples as well. So on 3rd August of 2020, KNCCI again received a letter, reference number MOH/DC/625/1 from the Ministry of Health, clarifying the specifications for reusable masks. Again, this is annexed in your document, Madam Chair. And on action points, KNCCI received the updated specifications. And this is after the intervention and the challenges our members were facing. Madam Chair, on 7th of August 2020, KNCCI received a letter from Kenya Medical Supplies Authority, KEMSA, on tender number KEMSA/DP03/2020/2021 for the supply of reusable masks. And therefore, KNCCI received this tender document from Kenya Medical Supplies on 7th August and received a letter from Kenya Medical Supplies again, Authority, on tender number KEMSA/DP03/2020/2021 for the supply of these masks. So on 8th of August, we as KNCCI made follow-ups and calls to all local manufacturers to submit their samples and authorization, their authorization letters. And therefore, we as KNCCI received manufacturers' authorization letters from these members and attached them to the tender document. So on 10th of August, Madam Chair, KNCCI started receiving sample test reports from the Kenya Bureau of Standards, and we received sample test reports on the same day. So again, the KNCCI on 12th of August 2020 submitted a response to Kenya Medical Supplies Agency on tender number KEMSA/DP03/2020/2021 for the supply of reusable masks. So then KNCCI responded to Kenya Medical Supplies Authority on tender number KEMSA/DP03/2020/2021 for the supply of reusable masks to inform the authority the update specification for reusable face masks as received from the Ministry of Health on 3rd August 2020 via letter reference MOH/DC625/1. Now, Madam Chair, if you look at Annex 2, there is a table. This is a price table as submitted to KEMSA, and due to the negotiations then we had initially with the previous specification that we had gotten from the Ministry of Health, our tender indicated that reusable face masks for children between 2 to 5 years, the quantity would be 750,000 at a unit cost of 37.5 Kenya shillings. This brought a net total price of 28,125,000. And then the reusable face masks for children between 6 to 12 years, again the unit cost was 38.5 at a quantity of 750,000, which brings a net total price of 28,875,000. The reusable face masks for teens and adults, it was given as 6 million as quantity, and the unit price was 41.5, and the net total came to 249 million Kenya shillings. So a total price for those face masks is 306 million Kenya shillings. However, it's good to note, Madam Chair, that we shall still continue to negotiate, and we shall negotiate with the local manufacturers, because some have different prices. Some are above the 41,000 or above the recommended price because of different issues that they have raised. But this we shall again sit with KEMSA. So the key requests, Madam Chair, is to ask or to request this committee under your leadership, Madam Chair, to intervene so that this process can be fast-tracked. I would want to tell you that to date, we have not signed any contract with KEMSA, neither have we received the 300 million as per the earlier agreement. However, this morning, we received a call from KEMSA detailing and requesting that we have a negotiation meeting tomorrow morning at 9 o'clock. So we would want to request this committee, Madam Chair, through you, through the chair, that as a private sector leadership, we call upon the leadership of Parliament for a joint and comprehensive post-COVID-19 recovery process and framework that is well tailored, coordinated to facilitate business recovery and livelihoods. We would want to request to work together to support progressive laws, legislation, and priority recommendations to government on future opportunities for local manufacturers and industrialization in Kenya. We would want the local manufacturers also to get equal opportunity in all government institutions. We would want local manufacturers to get equal opportunities, particularly in KEMSA, so that if they have 100 suppliers for a particular product, the local manufacturers should be given the preference. We would also want to request to develop recovery measures to revitalize export markets, financial support for trade and investment, and environment for job creation, particularly for youth and women as well. And we also request to provide support to help all businesses with essential support to facilitate recovery and means to operate and keep their employees and customers safe through the COVID-19. And therefore, in this regard, we submit that Kenyan National Chamber and Commerce and Industry has demonstrated its capability and commitment to ensuring a transparent and fair process in the support of local manufacturers. And since 12th of August 2020, we have not signed any document, and that should be on record. We have not received any amount of funds from KEMSA. It is then our humble request, Madam Chairperson and honorable members of the committee, to intervene and fast-track this process to ensure we meet the objectives of the government and the public-private partnership can be met, and at the same time to make sure that we are supporting the local manufacturers, particularly those I mentioned, Mama Boga, hawkers, the Juakali artisans, those in fashion industry. They're all our members, and they have a right to do business in any institution in this country. We would also want, on the same platform, to request, Madam Chair, that you, through this committee, you request the National Assembly to formulate a policy that will support the entire private sector and protect business community. With those few remarks, I still do have, in case of any questions, I will be able to answer. But for that, I do submit.
Thank you for your submission. And we were lost as a committee because we thought this was meant to be an emergency, kind of a procurement, and we're supposed to fast track. Maybe you can tell us if the meeting you will have tomorrow morning with KEMSA will be a successful meeting. What timelines are we looking at to have these masks? And I've also noted in your submission that some counties have they are missing. I've seen there are a total of around 50 persons who have qualified, who have done your submissions. So if today a dressmaker or somebody at Kangari Market would want to also participate in this tender, is it closed, or are you still reaching out? And how will you ensure that they reach to the specification that has been already approved by KEBS?
Thank you very much, Madam Chair. On your first question on how our discussions for tomorrow, I would just want to confirm that we, as the Kenya National Chamber of Commerce and Industry, have been ready. My committee, under the leadership of the Vice Chamber President, Dr. Eric Ruto, which is also the members, medics as well, have been working around the clock and waiting the day that we negotiate and sign with KEMSA. It reached a point that we could not go further because we needed that engagement with KEMSA. But I would want to confirm to this honorable committee, through the chair, that once the negotiations are in place between tomorrow and probably as early as possible, we have given a total timeline of 2 weeks for the country to receive those masks. On the second question about the number of samples we have received from counties, again, I had mentioned earlier, Honorable Chair, that we do not want to leave anyone behind. And we have sat with Kenya Bureau of Standards, and they have confirmed that they do have branches across the country, and they would also help us in capacity building these members so that they can also be able to understand on how they can make the samples and how they can meet the specifications. So once that is done, it comes tomorrow between us and them, then I believe that process will be escalated and we shall be able to meet our deadlines as well. But as we said again, through the National Governing Council and through the partnership we have with the Council of Governors, we shall work together to make sure that all people who are in that industry are also included, and more so during distribution, we shall work with those committees within the government and the agencies of the government to make sure that the right people, the right users will benefit from this program.
Thank you. I want to open it to members who would want to either comment or raise concerns. Dr. Nikau. Anybody else? Dr. Iseli and Honorable Owino. We finalize with Honorable Jagagwa.
Chair, thank you very much. Thank you, Chair of Chamber of Commerce. But let me tell you, we are a bit surprised. For us, when we met, we knew we were in emergency. And I think what we were expecting is that the ministry would get people already in the market who can produce, and you identify them. And we are very surprised that by now nobody has received our mask. It is clear that you took a longer view of developing capacity and developing industry. That's okay, but that's not what we expected when we voted this money. We expected to find people who are ready and get the products out. And let me say, we've just been with KEMSA, and we have expressed the same. So I will repeat the question of the chair. All these details, medical people, some of them are there. Medical people don't want all these details. The people are there, they are not sick, but they can be sick. If tomorrow you agree with KEMSA, what date are we going to be told all Kenyans that are vulnerable have got the masks that are available, and the matter comes to us that we have not covered everybody, more money still needed, and more money can be again made available to the ministry so that people get masks. In the background of how developing the capacity for the future, that is good. But that is how the way we saw it. When we discussed this thing, I think it was in April when we discussed this matter. So delivery for the emergency, developing of systems and capacity, I think you can come. We can meet again later in the health sector. For example, my greatest passion is how we can reduce the cost of drugs in this country. Again, that I think will lie there. But those are things we can discuss. Now, we wanted masks like yesterday.
Thank you very much for that question, Honorable Nikal.
Maybe you can take a few, like 3 or 4, then they're actually only 4 members. I've seen 4 interests, so let's go for one round first.
Thank you, Chair.
Dr. Iseli?
Just following on what Dr. Nikal has just said, I heard the President of the Chamber of Commerce saying that once they finalize this within 2 weeks, they'll have the masks available. But to me, that sounds like a promise that might not be fulfilled, because if you expect them to actually do all those masks within 2 weeks and supply, then you're not talking of small manufacturers. You're talking of fairly big manufacturers to be able to meet that. So I think let's be realistic in our projections, because as Dr. Nikal said, we wanted these masks like yesterday. So let's be realistic in our projections so that we don't give false hope.
Thank you. Honorable Wino.
Chair, let me thank the Kenya Commerce and all the affiliates. In fact, you have very good ideas, because in this chamber we have been talking a lot about local manufacturers, because that builds our economy, that engages young people, Mama Mboga, and also it saves us from joblessness, which we realize in this country. But the whole thing is a buff on our face, because that was not what we appropriated this money for. It was for emergency, because we had a pandemic. And you may not be responsible for that. We may look into the ministry and the KEMSA, who talked to us here and appeared as if tomorrow meeting is just finalizing, and you are saying you have not even signed a contract. You don't know even how that contract will look like. So we are surprised, because the whole thing has been ping-ponging, in a way that is not responding to the needs in the country. By the way, those masks were supposed to help the very impoverished populations, including the vulnerables. And if you ask me who is the vulnerable members, There are those who make first contact with COVID patients or index patients. That could be community health workers, Nyumba Kumi, all those first responders. Before we go to that old mama who cannot afford to buy. So all these people do not have masks. If you ask these MPs, when you go to your constituency, you buy your own mask and take to them.
Honorable
and yet,
Owino, we need to we need to summarize, so go to your point so that we can be able to
that
move.
Background was a little bit important to me with some passion. Now, if you were to give this in 2 weeks, you have two things, because now we are off emergency. How are you going to ensure that the people of Ndewa will also get this tender? What is your equitable distribution framework that you will use? And when you have already acquired, what is the framework for distribution? Or you will take them back to KEMSA for distribution? Thank you, Chair.
Honorable Chagagwa.
Thank you very much, Madam Chair. Let me first take this opportunity to thank the President of the Chamber of Commerce Kenyan chapter for that succinct presentation. Now, Bwanangatia, I'm certain you've been following what has been happening in this country for the last 1 month in matters COVID, for the last 3 weeks. Not that we rely on media for information, but I'm certain you've been seeing what has been going on. You've heard from my previous members who made their submissions that we appropriated 300 million for purposes of making of masks for the vulnerable. The CS, Honorable Mutai Kagwa, was here yesterday, was here the last week, and yesterday was forming about his third time was appearing before us. And what he has told us is that they are in consultation, or they are going to give you that job, or they have given the job to the Chamber of Commerce, something close to that. Now, when I've listened to you, you are saying that there hasn't been any agreement entered into between you and KEMSA. Now that brings me to my question. Since this was a pandemic, and we were meant to buy, or the man was meant to buy masks for the vulnerable members of this society, how would you characterize KEMSA's action? Are they deliberately dragging their feet not to give you this job? Are they lethargic? Or are they not concerned about the Kenyan people? Because as we sit here, talk about the 300 million. As you sit here, talk about the meetings you're going to have. As we sit here, you talk about the presentation you've made before them. Kenyans are dying. Kenyans have died because of the lack of a mask. Or is it that maybe your prices? You know, I hear you are quoting a price of 35 shillings per mask, a reusable mask, while we've been talking here about the wastage of public funds. Because we're buying one mask at 700 shillings. Is it because of your prices that they are not willing to contract you, or the Chamber of Commerce? Because they will not make the profits that they would have wished to. Thank you.
Thank you. You can respond, Mr. Gatia.
Thank you very much, Madam Chair. I think I'd want to respond to the first question by Honorable Nikal. In terms of your question on timelines of masks. Again, I just said that we have been hoping to be called for these negotiations, which has not happened. However, the ministry, if you look at the documents that we have given, everything moved with speed, and we were anticipating that by now, everybody, all the vulnerable groups will be having the masks. If you go back to my presentation, I said that per day, already the manufacturers who have shown interest can be able to, they have a capacity of delivering per day 1.8 million. So we are saying in a week, actually, they can be able to manufacture. However, there's still another process of packaging. There's still another process of sanitizing those masks. And that's why I gave it 2 weeks. So for that, I'm saying we shall be able to meet those timelines. For the second question, in terms of projections, again, I believe that is one and the same questions. We are looking at 2 weeks. And again, because of the support we are getting from the bigger manufacturers, we believe we shall be able to meet that deadline. There is a third question, Honorable Member, the local manufacturer and why we have not signed a contract. Again, here I've seen also a few challenges. When KEMSA was mandated to contact us, they did very quickly. The communication that is already before you shows you that we have been communicating with them. Unfortunately, because of the changes that have been at KEMSA, then the people who are there, this was new to them, I believe. But at the same time, we have been reaching out to KEMSA on a daily basis. We have been reaching out, but the response is that they are in Parliament or they are in other institutions trying to solve issues that are already at hand. For the fourth question, this is on how we can ensure what confirms or how we can ensure the framework for distribution. Again, here and according to the agreement with the Ministry of Health is that the Kenya National Chamber of Commerce and Industry will take lead and all masks will be provided to us as the Kenya National Chamber at our chapters in all 47 counties and then delivered to KEMSA. KEMSA will be doing the distribution. However, the negotiations for tomorrow will touch on the mode of distribution. Should those masks come from all counties to Nairobi, or should they go to the depots of KEMSA and distribution points, or otherwise? Then that way, the negotiation will be able to determine how the distribution will be made. But we as the chamber, we are happy to offer any support in terms of distribution and to make sure that it goes to the right counties and to the right intended purpose. On Honorable Member, on your question, the fifth question, on about the agreement and how I would characterize KEMSA and also regarding the price of masks. And I'm happy because I'm saying Dr. Nyikal is here, he's a medic and he knows that the reusable mask cannot be used by doctors. That doctors require specific specifications for isolation centers, for ICUs, for wards, and at the same time for any COVID-related cases as they interact with the patients. So the reusable masks are there to support the vulnerable groups, and because of the budget again, you want that person to keep that mask for 6 months or more. They can use it a day or two and wash it and continue wearing that mask. So again, that answers your question on prices. The prices that these other masks are costing higher than those local masks is specifically because of the high standards and specifics. I would want to tell you, for example, Honorable Member, because of that question, the mask you're wearing and the mask I am wearing are totally different. What I am wearing is 98.8 filtration, which is conducive for any ICU. I will not think yours for COVID will be conducive for that purpose. So I'm saying, Honorable Members, for us, we are waiting for this contract, but I would like the chair of the Health Committee at the Chamber, Dr. Eric Ruto, who is our first Vice President, just to support my argument.
Okay, thank you very much, Honorable Chair and Honorable Members. I want to support and affirm what you've done as a Kenya National Chamber of Commerce, and also to respond to the questions which are being raised by Honorable Members. The first one was Honorable Nyikal, and you talked about building capacity for industry. What I would like to affirm is that actually we are not going to new manufacturers. These are existing manufacturers, and they already have the capacity. And from our baseline survey, we have been able to establish that they can be able to produce 1.8 million masks per day. So in terms of urgency, we definitely appreciate your concern. The only bottleneck has been between us and KEMSA. There was also another question which was raised about equity. And I think this is something that is going to the heart of each and every Kenyan in this country. What we have done as Kenya National Chamber of Commerce, and I can affirm that of the 332 companies, we have received from each and every part of this country, from 47 counties. What we are going to do, based on the capacity, we are going to distribute this opportunity on pro rata basis based on the capacity of each and every company across this country. So that one definitely I appreciate. So therefore, as the National Assembly and the Health Committee, we urge you so that we can quicken and fasten the process. If we are able to sign a contract with KEMSA, we can be able to provide these masks within 2 weeks. Thank you very much.
Thank you. I think we would, unless there be any other concern from members, one of the things is you do a negotiation as chamber with the KEMSA. We again don't want to incur more expenditure distributing these masks. So I hope then you can be, if you have every county covered by these tailors, it will be easier for them to tailor for the county and distribute within the county, instead of them bringing them back to Nairobi and then back again, just to have some value for money. I hope you also be keen with quality. I was just going through your documents. I've seen some of them, you've reached to the Mwananchi. I've seen Kega fashioned in Kikuyu, Kiambu County. But also be careful, Chair, and I heard your vice saying that, your deputy saying that they are reputable companies. Because when I see Mabunia's Construction Company Limited doing reusable masks, then I am hoping then you will not be duped to be given just for sample case, and when the real work will be done. I've also seen another one, Tolu Cleaning Services, and they say they are renowned for producers of reusable face masks. So maybe it's a business name. I will not judge them on face value, but just be careful.
Thank you, Madam Chair.
So that we give Kenyans quality, and of course we get value for money. So as you work with the KEMSA tomorrow, I hope then you can be able to sort out that the ministry can actually give you their plan of distribution, whether it's the Interior or it's the Ministry of Health, so that then for example, in Nairobi, then we need this number of masks, let them be produced in Nairobi. Then we'll have, the weight will be worth. It would not make sense if the masks are made in Nairobi to be taken to Marsabit or Mombasa. Thank you, Chair. Unless you have something else to say.
Madam Chair.
Yes.
Madam Chair, yes.
Honorable
Madam Chair, I raised my hand.
Oh, I didn't see it.
Yes,
There's
okay.
something blocking
yes,
me here.
thank you, Madam Chair. Yeah, okay.
Proceed.
Madam Chair.
Proceed. Honorable Joseph, did you have something? It's okay. Let the Vice Chair goes first, and then you can give your comment.
Madam Chair, listening to the President of Chamber of Commerce, Madam Chair, business people, they are supposed to be time conscious. But from the program that he has developed here today, Madam Chair, from the beginning, the first time they started engagement was on 23rd June. Up to today, the last communication was 12th August. That was back and forth, the engagement between Chamber of Commerce, Ministry, and KEMSA. Chairman, the President for Chamber of Commerce, it is only government that we associate with bureaucracy and laxity and communication breakdown. But I could see a lot of bureaucracy here, the back and forth. Whereas you are passing the blame to KEMSA, they've been also, as in a lot of time that has been taken by even by National Chamber of Commerce. Which brings now the big question. Why all the 3 months? And remember the money that was released, because it is 2.5 months. The money was for emergency. Do you know very well when it comes to the issue of emergency, it should not take more than 7 days. It should have taken 7 days. It should have been taken 1 day. If it comes to the issue of Sambo, it should not have taken 14 days the way you have taken. What you should have done is to come up with one Sambo, test it with Kenya Bureau of Standards, and then send it to the manufacturers, saying that this is the standardized mask that will be required for distribution. But now look here, you are falling into the same mess that we have now with other institutions like KEMSA. And then 2, you've raised concern here that your biggest challenge or bottlenecks in distribution on manufacturing of these masks is KEMSA. Then it brings me to the other question. You as the president of Chamber of Commerce, you know that the minister is there. This was a presidential directive for 2 reasons. One was to build capacity for your members. Build Kenya, buy Kenya. And then 2, ensure that there is face mask for protection. At that time when there was crisis, now it is 3 months. The same people, your members, they have not even gotten the money. You should have, today, the question here that everybody should be asking you is that why haven't you approached the cabinet minister, secretary, over this matter if there is bureaucracy at KEMSA? And then when there is delay, it raises suspicion. That there is then again, was there bureaucracy in identification of the members? Was there negotiation and discussion on how much it is going to be what people are going to make? So then we give to this company, we give to this company, we are not going to give this company. And then lastly, assure the committee and Kenyans and your members in general, because I'm speaking also on behalf of many small traders and manufacturers, that you have put in place mechanism that is going to ensure free and fair identification of manufacturers. It should not be selective process where tomorrow there will be traders or manufacturers who will be demonstrating against the government saying this government did not consider us. And you know this has become the song in this country. This is anything that comes up, it is the president. Yet in this case, the president on his own then decided, I will send money to Kenya Chamber of Commerce. Then the Chamber of Commerce will use their own internal mechanism and framework to identify the companies which are going to manufacture face mask. So assure Kenyans and your members that it is going to be a free and fair process of identifying the manufacturers. I thank you.
Thank you, Vice Chair. I hope you can respond in very brief words.
Okay, thank you very much, Madam Chair. Let me respond to Honorable Kutuni. Your first question is whether we are time conscious. I have demonstrated without any doubt that we have attempted to reach out to KEMSA so that they can be able to fast track. I do understand and agree with you that on emergency basis, it should take the shortest time possible. And in terms of the samples, and you talked of 14 days, I just want to tell you that remember that this is new to everybody, including those local manufacturers. And therefore they needed to be guided on what to do, what material to use, the specifications that will meet the required mask, whether it is actually to be, to let you know is that some of them delivered samples, but those samples were one ply. the recommendation was 3-ply. And therefore, those kind of specifications, sizes, the bands they need to use, the color, the marking, that took time. Remember, each sample had to be printed or embroidered, MOH, GOK. So that also takes a bit of time. They were also requested to bring the packaging. That also takes a bit of time. Remember, packing a mask, you need also the intervention of NEMA because of the plastic bags. That again takes a lot of time. And therefore, as we were waiting for this negotiation, because we saw the challenges our members are facing, and we wanted during the negotiations to request that using the new specifications that have been provided by KEMSA and the Ministry of Health, we can then just have one standardized sample that we shall give, including when we are issuing out the orders, we shall give to these local manufacturers. The other question is, yes, you've just alluded that, yes, this is a presidential directions, and we were trying to make sure that all these manufacturers are also supported. However, sometimes, Madam Chair, we do have no control of certain institutions. And therefore, when we try to make telephone calls and we are told to wait, we only wait. When we found and noted that this has taken far too long, yes, we did reach out to the Ministry of Health, and I believe they intervened, and that is why we were called this morning to go and fast-track the process. And you've talked about the bureaucracy. You talked about KEMSA. Again, we have no control as the Kenya National Chamber of Commerce and Industry, and for that reason, we are asking this committee, and I will say this again, help us, the private sector, to put a policy framework, to formulate a policy that will support the private sector, so that we mitigate all these problems we are seeing, all these gaps we are seeing, all these roadblocks we are seeing. We want to have a conducive environment for all businesses, for all those manufacturers. You can imagine the same local manufacturers you're talking about. They are already frustrated because they can also see that the time has taken far too long. Your last question, Honorable Kuchuni, through the chair, is how do we assure traders of free and fair processes? Again, I want to confirm to you, Honorable Chair, that we have attempted at all times to communicate, to disseminate information through the members of the Fourth Estate who are here, and we have had several press conferences. Secondly, we have engaged our National Governing Council to also disseminate this information to everyone. And we are saying we have not closed. We are still reaching out. Please remember that not everybody wants to get into the business because they are not manufacturers, but we are encouraging them. There are those who feel they'll not be able to deliver because they don't have the capacity. And that is why we have come back to say, look, we as the Kenya National Chamber, we have a program with the MasterCard Foundation and other institutions, financial institutions like Equity Bank, and who can come to support them. For this MasterCard Foundation, it is interest-free, and I believe we shall reach out to them to also take up, because we cannot pay them in advance. And therefore, we have a mechanism to make sure that we reach out to them and they take the resources available so that they can be able to deliver these goods on time. And therefore, we shall commit to you that this process shall be free and fair. We shall, at every time, every moment, we shall communicate through the partnership we have with the reputable companies and reputable media stations so that they can also disseminate that information to the public and so that they can be able to see exactly what you're doing. Thank you, Chair.
Thank you very much. Members, I would want we end that one at that level. And if you have suggestions on how these members would assist the chamber, and especially on formulating policy framework, anytime you can reach out to any of our members of this house and we can be able to assist. We wish you all the best in the negotiations, and thank you very much.
Honorable Chair.
Members, it's almost 5. We have 3 more, so kindly. I think that matter we have dispensed it. Kindly. So I'd request the members from Chamber of Commerce to take leave so that we can be able to take the next submission. And the next submission is from Crown. So as we prepare, I don't think you need to come to the front. I request the team from Crown Healthcare to introduce themselves.
Madam Chair, should I seek your intelligence? Madam Chair, with this report that has been tabled,
by?
The joint report by...
The Chamber?
Yes, by Megascope, Crown, and is it they are going to present it jointly or?
No.
I seek your advice, Madam Chair.
I think there's several submissions. Crown has done their own submission.
Yes.
So each and everyone will do their own presentation. Some might be very short, actually.
Okay.
If members, we go direct to the point. We don't over-explain. We might be able to save a lot of time, and we can be done within the next 1 hour. So that means we'll be done by around 6. But if we extend this, we'll be here up to 7. So let's just be conscious of time. I request the person in charge of Crown Healthcare to introduce yourself and introduce your team.
Madam Chair Lady, honorable members, my name is Shilan Chakrar, and I'm the CEO of Crown Healthcare. With me today, I have in our team Mr. Francis Muthiani, who is the head of operations, Crown Healthcare. I also have with me Mr. Brian Sitima, who's in-house legal counsel, and Mr. Dennis Mosata, who's a legal counsel. Madam Chair, we are here in response to your invitation letter dated 1st of September 2020.
Just hold on, because we have entered into a new session and I need to do an explanation on why we have the 3 companies. 2 of the companies, all of you have traded with KEMSA, and we had to take a sample of the companies that have traded with KEMSA with the documents that we have. Some of you at different stages of procurement, and specifically Crown Healthcare. And I want to apologize because the letter that came to you and Megascope, there was a wording that the committee is aware that your companies were appointed and authorized by KEMSA to clear JACMA. So that one was, it was not properly written. So I'd like to withdraw that statement and say there were allegations that your company was involved in clearance of JACMA's foundation. I think that was something I'd like to apologize. That came from our clerk of the National Assembly, and that one I want to take out that part of that we are aware. There was allegation that your company was involved in clearing of JACMA foundation, but you will clear that. So you can go ahead. I just needed to do that clarification before we start this meeting. Proceed.
Madam Chair and honorable members, we are here in response to your invitation dated 1st of September 2020, reference NADCS Health /2020-081, requiring us to appear before you and make submissions on the following 2 issues. Firstly, the role played by our company, Crown Healthcare, in clearing the JACMA Foundation COVID-19 supplies from Jomo Kenyatta International Airport. And 2, a detailed report on what our company, Crown Healthcare, supplied to KEMSA since March 2020 and what was the procurement process undertaken. I'd firstly like to give you a bit of a background on Crown Healthcare. Crown Healthcare has been in the business of provision of total hospital solutions, namely supply of medical, laboratory equipment, and pharmaceuticals since 1998.
Sorry to interfere, but I would like you properly wear your mask. You properly wear your mask. Just pull up your mask.
Thank you.
Thank you. Proceed.
And therefore, with experience, expertise, and the capacity spanning for more than 20 years, I'd like to state at this juncture that we also have a team of more than 350. Madam Chair, it'll pleasantly surprise you to learn that some of your current members are former sales reps of the company. We have been in this business for long enough. This is not our first business. Our major clientele is mainly the private and the mission sector, with minimal supplies to government institutions. Madam Chair Lady and honorable members, we are pleased to make the following submissions in response to the two issues raised in your letter as follows. Firstly, the alleged role in the purported clearance of the COVID-19 Jack Ma Foundation donations. Madam Chair, honorable members, the allegation that our company were involved in the clearing or in any way handling the Jack Ma Foundations is false and defamatory against us as a company. We totally reject and refute the allegations leveled against our reputable company as utter falsehoods without any factual...
Madam Chair, sorry to interrupt the gentleman as he's making his presentation.
And also properly put on
I
your
would
mask.
seek
Honorable Chagagwa.
I would seek your directions.
Yes.
We were here yesterday when we invited the CS,
Yes.
Minister of Transport. He was not able to attend in person, and he sent the cars, Honorable Senator Klizobure, this morning, who actually clarified that all the Jack Ma items, donations, equipment, name it, are actually cleared by a government agency. The letter that you've read out to the parties is to the effect that there were allegations, or maybe rumors, but the chair was very candid, there were allegations. Now, if we were certain, and the CAS was able to explain to this committee and to Kenyans that the goods were actually cleared by a government agency, Madam Chair, is there any need of us to sit here to interrogate that statement and they are just rumors? They are just allegations?
Honorable
You know,
Chagagwa.
we do not, sorry Madam Chair to interrupt you, but Parliament should not legislate or seem to work in vain. That point was explained, and there was not a single item that we were told was cleared by Megascope or the other companies. For
Honorable Chagagwa, you'll allow, all these letters went out at the same time,
Yes.
including the clarification that you are alluding to. And so since I've seen the explanation is long, let them just finish for the purposes of records that also the companies came and appeared before us. And I've seen how he's going, it's just summarized. Let him finalize.
Okay,
it's actually 2 or 3 statements. Now, if you didn't interrupt, you'll be done with that
Chair,
matter.
I'm saving you time and this committee time.
You are now wasting
the company
Chair,
is
we're wasting more time here.
The company
Exactly.
is represented
We
by
are wasting more
It's
time.
all right.
Council.
Honorable Chagagwa, let him proceed and finish so that it goes on record.
A single word would say, we never cleared, and we are done.
Honorable Chagagwa, allow him just to proceed. Proceed.
Thank you, Madam Chair. I'd like to carry on. As a matter of fact, so we've totally rejected and refute the allegations leveled against our reputable company as utter falsehoods and without any factual basis. As a matter of fact, we have instituted legal action against the media, against Nation Media House and individuals that published and disseminated this outrageous allegations in the first instance in a purported expose aired in local TV. Copies of the legal complaints are enclosed in the documents submitted to this committee. For the record and clarity, we wish to say this as follows. Our company is not in the logistics, clearing and forwarding industry as alleged or at all. Our company was not involved in the alleged clearing of the Jack Ma Foundation donations as alleged or in any matter whatsoever. Our company was not and has never been involved in the clearance of any consignment and donations on behalf of KEMSA or, for that matter, any other entity whatsoever. The allegations against our company are unfortunate, false, and malicious. This is all we have to say in response to the allegations on clearing of the Jack Ma Foundation COVID-19 donations before this honorable committee. Madam Chair and honorable members, I will go on to the next question.
Proceed.
Which was particulars of our company's supplies to KEMSA as from March 2020. I would like to categorically state that we have not, as Crown Healthcare, supplied any PPE to KEMSA. Madam Chair, however, since March 2020, our company have supplied 2 items in relation to the COVID-19 pandemic interventions under the following contracts, whose particulars are as follows. Tender number KEMSA DP 25-219-2020, supply of ventilators valued at 12 million shillings. Tender number KEMSA DP 73 2019-2020, supply of sterile gloves, surgical, valued at approximately 38 million shillings. Again, all documentations have been submitted to this committee. As I mentioned, we have prepared a detailed submission of both the tenders for your reference. Compliance with legal provisions. Madam Chair and honorable members, first and foremost, we state that our dealings with KEMSA in discharge of the aforementioned contracts were in compliance and in adherence to the express and implied provisions and principles of Article 227 of the Constitution, which provides that when a state organ or any other public entity contracts for goods or services, it shall do so in a manner that is transparent, competitive, and cost-effective. We do confirm and has demonstrated in our submissions that our prices for all the items supplied were indeed competitive and at the prevailing market prices, and thus in compliance with the constitutional requirements. I may add that the surgical sterile gloves have actually indeed increased in price since the supply was made. We confirm that our dealings with KEMSA have been in strict compliance with the procurement provisions on our capacity, qualifications, and eligibility to submit bids by dint of. We are duly eligible to submit bids before a procurement entity in accordance with Section 55 PPDA. We have not engaged in any inappropriate influence or corrupt practices as spelled out under Section 65 and 66 of the PPDA, which would render us ineligible to bid. We have not been debarred from participating in any procurement proceedings as provided by Part 4, in particular Section 41 of PPDA Act. And lastly, all our quoted prices are based on competitive and fair market prices. The procurement process. Madam Chair, you are aware that His Excellency the President, by virtue of the Executive Order 2 of 2020, issued on the 28th February 2020, declared COVID-19 a national pandemic. Based on what we were convicted of the fact that any emergency procurement related to COVID-19 would not follow the normal procurement process, as it would be about saving lives. In participation of such procurement, we satisfied all criteria under provisions of Section 91, 92, 103 of the PPDA Act in relation to direct procurement legally recognized and as an alternative method of procurement. We would further like to state as follows, that there was an urgent need for the government to procure various medical items in light of the COVID-19 pandemic, and we had the capacity and expertise to meet such needs. Our company is one of the few well-known reputable medical suppliers in the industry and in the region, as previously stated, having provided medical equipment and solutions to clients for more than 20 years. We have maintained a reputation of supplying quality medical equipment, consumables at fair prices within the market. We were probably one of the few companies that were able to supply ventilators and gloves and had those stocks in the country at that time. From our submissions, the committee will note that the ventilators and gloves supplied to KEMSA were part of the consignment of assorted medical items which we had already imported in October 2019. All the documentations are in this submission. Our prices were competitive and comparative to the market prices. Indeed, we have, as part of our submissions, provided documentation of similar supplies to private hospitals around the same period. In fact, this morning, we have again supplied a similar model of ventilator supplied to KEMSA to a private entity at the same price. I state again, all the documentations have been provided. On the gloves, we have similarly provided documents to show that the prices around the same period supplied to private entities were competitive to the prices quoted to KEMSA. The current prices of this commodity are still rising. The lead time for delivery has gone up from 30 to 300 days. It is imperative for the record for the committee to note that we are duly registered and licensed by the Pharmacy and Poisons Board to import and supply medical devices and consumables. Documents to support the same are duly enclosed in our submissions on the two items that we have supplied to KEMSA. We have the production registration certificates duly issued as follows. For the ventilators, Pharmacy and Poisons Board registration number 14, issued on the 6th of June 2019 and expiring on the 31st of December 2020. Secondly, for the sterile surgical gloves, Pharmacy and Poisons Board registration number 1826, issued on the 13th of November 2019, expiring on the 31st of December 2020. Clearly, from the foregoing, the committee can take note of the fact that we did not premeditate to benefit in any way from the COVID-19 pandemic, as this is our normal course of business. In fact, we played our role of assisting to respond to the emergency as we would have sold the same items in the open market at the same prices and without the resultant delays in payment and attendant inconveniences. We supply quality certified items, installed and commissioned the ventilators at the Kenyatta National Hospital, and we further went ahead to train as many users possible on the use of this equipment. In our submission, we have provided the installation job cards, photos of the actual training of the medical personnel, a schedule of the names and designations of the personnel trained. The committee should take note that the supply and the installation of this life-saving equipment was done at the peak of the pandemic, and we are sure, due to our timely intervention, we played a part in saving numerous lives of our fellow citizens. Madam Chair, as it now stands, despite having supplied the equipment to KEMSA, installing and servicing the ventilators, our company has still yet to be paid by KEMSA. The comparative invoices provided in relation to the private sector supplies have all been duly settled. We fully support the probe of this committee and any other investigative agencies. We implore on this honorable committee to get to the bottom of the matter and leave no stone unturned in establishing the truth. It will be instructive for the for the source of these allegations to table any documentary evidence they may have to this honorable committee. Thank you, Madam Chair and honorable members, for giving us the opportunity to set the record straight and to enable us to table the facts as they are in relation to Crown Healthcare Limited. Thank you.
Thank you for your submission, and I request that you just hold on. We go to Megascope, and you can do a summary also, so that you just answer straight. You don't have to go through the entire document, but highlight what is important. And Megascope, introduce yourself and your team.
Thank you very much, Madam Chair. My name is Richard Ngatia. I am the Managing Director of Megascope Healthcare Kenya Limited.
Good evening, Madam Chair and honorable members. My name is Reni Nyando Lupalo, the General Manager, Megascope Healthcare. Thank you.
Good evening, Madam Chair. My name is Irene Mwangi. I'm Head of Department, Sales and Marketing, Megascope Healthcare Kenya Limited.
Madam Chair, honorable members, my name is Njoroge Regero, advocate for Megascope Healthcare Kenya Limited.
Good evening. My name is Claire Mwangi, advocate for Megascope Healthcare Limited.
Good evening. My name is Dorothy Akello. I work for Megascope Healthcare as the Chief Administrator.
We can proceed, Megascope.
All right, thank you very much, Madam Chair. I'm here to respond to two questions that were sent to us during the invitation for today. And therefore, Madam Chair, we are in receipt of your letter regarding one of the subjects which involved the Jack Ma's Foundation COVID-19 supplies, clearance, and supply of other COVID-19 related items. And therefore, on invitation through the chair of this Honorable Departmental Committee of Health, we are here to respond on the allegations that have maliciously dragged Megascope Healthcare Kenya Limited name into the alleged disappearance of Jack Ma Foundation donation to Kenya. So the invitation we received indicated that your committee is aware that our company was appointed and authorized by KEMSA to clear the Jack Ma's consignment for Jomo Kenyatta International Airport. But I am glad, Madam Chair, because you have corrected and you have actually confirmed it was erroneous in your invitation. It should not have read aware. Therefore, we wish to introduce Megascope Healthcare Kenya Limited as a supplier and distributor of medical equipment and hospital disposables since its inception in the year 2002. Megascope Healthcare Kenya Limited has gained unmatched reputation for our knowledge of vital hospital equipment used.
What is out of order?
Actually, there's nothing out of order, but I'm seeking your directions. You've just been served with a document which is a notice of motion, and at the end of it, I've seen a ruling by Duranera J admitting this matter for hearing. Interparties, I think, on for directions on 10th of September. Madam Chair, going by the letter that the clerk sent to Megascope to appear before us and shed light on matters of Jack Ma equipment clearance or clearing, and on a casual perusal, Madam Chair, of the notice of motion and the grounds thereto.
Which notice are you referring to?
Notice of motion, Madam Chair, a court document. It is a civil suit number E094 of 2020.
Oh, okay.
At Milimani Law Court, Civil Division. So, Madam Chair, on a casual peruse of the grounds in support of this notice of motion, it's very clear that what Megascope is here, what we have called them here to come and shed light on, is actually again being arbitrated to at the High Court. So, Madam Chair, with your kind permission, I would wish to refer you and this committee to the ruling that was delivered by the Honorable Speaker a while back. A minute, Madam Chair. The ruling that was delivered by Honorable Justin Muturi about a similar matter, that a petition that had been, I wish Moyondi would let me discuss with Madam Chair or put my points across without interference. A ruling that was delivered by Honorable Justin Bidan Muturi a while back in a normal similar matter, that was a civil appeal number 33 of 2016, being a Commission of Customs Services versus Bidco Oil Refineries Limited. A matter had been referred to the Labour Committee, and an issue of sub judice was raised. And the Speaker was very clear and categorical. You may discuss, the Committee of Labour may discuss any matter that had been referred by Honorable Judy Jomo to the Labour Committee. Safe, and mark my words, you should not discuss matters that will be canvassed in court. So that this Parliament or its committees do not get into matters that are being litigated by parties in the High Court. And that is the basis of the rule of sub judice. So that two arms of government are not litigating on one matter. And now I seek your directions. A minute,
Madam Chair.
Honorable Ligero, a minute. Through the Chair. I'm
you know,
seeking your direction.
Jagagwa, yeah, you
I'm
just
seeking
go
your
straight to the
directions.
point, yes.
I want to lay down the basis of my, for you to make a ruling, Madam Chair.
Yes,
so,
proceed.
Having if we were to discuss, if we were to sit as this committee and discuss these matters, which are already again in court, we'll be guilty of the rule of sub judice. Now I'm seeking your direction. Is it fair for us as a committee to discuss that matter, which is again being canvassed at the High Court?
I think,
That's it.
Honorable Jagagwa, we've already had an earlier submission, and this matter we have discussed it, not even today, even when the ministry came. It's a matter of public interest. We are the people's representative. We are not here to make a ruling. And there is a submission, and that's why I told and asked the person presenting from Megascope to just go straight to the point. The question was, did you not supply, were you involved in the clearance? And I think with the Crown Health, it was very clear. That doesn't stop us, because we are not here to make a ruling now. So I plead that we proceed, and I also want to ask Mr. Ngatia to be brief to the point. Just answer the question as it was asked, and then we proceed, because that's not the only matter that we call Megascope to come and discuss. Megascope is also a supplier at KEMSA. The same way Crown Health has done, will still go through the same. So,
with your kind permission, Madam Chair, could I come in, please, on the issue of that pending suit?
Okay.
In fact, I'm specifically here to address the committee on that suit, because I am the one litigating in the High Court, and arising out of the very adverse allegations that were made by NTV, we have instituted that civil case, A94 of 2020. It is under very active prosecution. The judge, as you will see in our bundles, there's an order that has been made, and directing the parties to respond within 7 days, and we go back on the 10th of this month to argue that matter. The effect is that in your standing orders, number 89, that order kicks in and debars the National Assembly or any of its committees from discussing anything that is a subject of pending litigation. In particular, 89.2 says, a matter shall be considered to be sub judice when it refers to active criminal or civil proceedings, and the discussion of such matter is likely to prejudice its fair determination. The allegations, Madam Chair, that gave rise to the defamation suit are the very, very same matters that are before your committee. It was alleged that we were involved in clearing of goods, that we received the Jackma goods that were not accounted for. And those are the very, very same issues that are being investigated here. I agree with Honorable Njagagwa that there is that danger then of a conflict between the court that is going to hear and determine this matter and this committee. And I think we had a professional duty to draw your attention to the existence of that suit. The bundle is there. Ultimately, you will have to give us directions as to how to proceed. It is a fine balancing act because, yes, there is public interest. You want to raise questions that arise out of the dealings to do with a very serious issue to do with COVID-19. But at the same time, you have the sub judice rule that exists to ensure that there is separation of powers and we are not prejudiced or embarrassed in court because of what might be said here. So mine was to draw your attention to that, even as you direct how they should proceed.
I think when the director was doing the presentation, would have raised if you're not comfortable, saying yes or no. Because as I've said, this matter is there out of public interest. We are not here to prosecute it and say you are guilty or not guilty. We only ask for submission. So it's a simple yes or no, and we proceed because there are other matters that we have asked Megascope, not just about the Jackma. So as simple as that, Director, if you're comfortable, you can go ahead. If you're not comfortable, you say you wish to skip because you have gone to court because of that matter, and then we go on.
And Chair, before even Madam Chair, you go that direction. Madam Chair, we have an issue. Madam Chair, Nyagagwa is a member of the committee. And Madam Chair, I think it is fair. It is fair for the public. We are the representative of the people. And even if as a member want to protect the people appearing in the committee, I think it is better to do it in a clever manner. Just not to do it in that, just, you know. Madam Chair, anyone who is a friend to Megascope, including their lawyer, they will appreciate that the committee is sitting to listen to their issues. And then two, Madam Chair, there are two issues here. There is the public court in this country which condemn people, make judgment, and find people guilty without getting even facts. And then there is now the legal process where you prove that you are guilty. And I think it is this mob justice that is being done by the public sometimes, such a kind of engagement between the parties, quote unquote, accused and Parliament, which is doing investigation, provide a robust platform for these companies to tell the public what actually happened. I can imagine a situation where we say that we are letting Megascope to go just because of a matter that is in court. What is the public going to expect? They can make their own conclusion. So I will appeal to Megascope to, for once, to ignore the matter that is in court. Yes, the ruling, the standing orders, all those issues are there. But for the public, I will appeal that please, Nangatia, Your Excellency, you ventilate on this matter in the floor of this House.
And I said it's a choice. Mr. Gatia, if you feel that this will jeopardize the process in court, you can decide to do so. But if you just want to say a simple yes or no, we are also on this process. We met the ministry. I think the Crown, they were very, they had a chance to express themselves. So I don't think there's any jeopardy because you're not here to make a ruling. You're only doing a presentation. After that, we as a committee will sit, we'll have to table a report to Parliament. But the fact that your case is in court doesn't stop us from asking and doesn't stop the public from asking those hard questions.
Chair, may I add my voice here? Megascope, you have an opportunity. You either take it or leave it.
Madam Chair, I think let me just continue with my presentation. But I've noted your concerns and I've noted the concern of my legal counsel, Manajeroge Rigero. So it is also important, honorable committee members, through the chair, that the same members of the public should be able to know who this Megascope Healthcare Kenya Limited is. And it is good just to introduce ourselves as a supplier and distributor of medical equipment and hospital disposable scenes the year 2002, like I had mentioned earlier, and Megascope Healthcare Kenya Limited has gained and matched a reputation for our knowledge for vital hospital equipment used in critical care and anesthesia machines, radiology, central sterilization units, ophthalmology, dentistry, laboratory, physiotherapy, and electrotherapy equipment, to name but a few. So just to mention also a few of our customers, who include also KEMSA, is the government public hospitals, some of which are Kenyatta National Hospital, Moi Teaching and Referral Hospital, Jomo Kenyatta University Hospital, Ministry of Health, and also the private hospitals as well. Namely, we do have, and we do also supply to Aga Khan University Hospital. We also engage with the Kenya Red Cross, Medical Essential Supplies, who are MEDS, African Development Bank, Ministry of Education, Nairobi Hospital, Mata Hospital, Gertrude's Children's Hospital, St. Mary's Mission Hospital, Elgon View Hospitals. If I continue, then we shall leave here in the next 3 to 4 hours. So I want to say that besides the above-mentioned institutions, we also sell to private retailers as well across these counties of this country, beautiful country, Kenya. And our scope of business and operations has witnessed exponential growth from distribution of medical equipment to capacity building, with an objective to see that those in the medical fraternity, specifically biomedical engineers, become more adept in their skills. We, as Megascope Healthcare, have an already confirmed training center. This training center has also been is a center of excellence for both East and Central Africa, where we do train these biomedical engineers, radiographers, radiologists, and they come for this capacity building. So Megascope has also partnered with globally renowned brands such as Mindray Shenzhen in China, Neosoft Medical Systems in China, Tutnauer in Israel, Cavo Dental in Germany, Stefanix in France, Ahmed in China, and many other companies including US, UK, Europe, South Africa, Turkey, and also Pakistan. I would now wish to respond just to raise concerns on the question of the JACMA issues, and we wish to be very categorical and clarify that Megascope Healthcare Kenya Limited has never been registered as a clearing agent. I want to repeat that. Megascope Healthcare Kenya Limited has never been registered as a clearing agent of any sort, and as such does not have the mandate to clear any consignments. Further, Megascope Healthcare Kenya Limited has never been engaged by any government agency nor KEMSA to clear any COVID-19 related consignments, including the donations from JACMA. Be therefore informed that we did not clear the JACMA donated COVID-19 cargo, and therefore have no further statement to this, as we are pursuing the matter through the court of law, as it has been alluded by our counsel, the lawyer, Joroge Rigero, and I'm here by my legal counsel to confirm the same, that the answer is no, we did not clear. I do want to also respond to your second question, which you asked a detailed report on what Megascope Healthcare Kenya Limited supplied to KEMSA since March 2020 and what was the procurement process undertaken. Megascope Healthcare Kenya Limited has been a supplier again since the year I mentioned, and we have grown in our client base, being a reliable supplier of quality healthcare products, of medical equipment in Kenya, and also providing solutions and turnkey projects. Among our clients is the Kenya Medical Supplies Authority, that is KEMSA, that upon detection of the first case of COVID-19 in Kenya on 12th March of 2020, our clients in healthcare industry started their preparedness to ensure infection prevention and readiness to attend to patients with COVID-19. And among the preparedness was the urgent procurement of personal protective equipment that include coveralls with shoe covers, medical goggles, KN95, face masks, natural gloves, and face shields as well, and not forgetting ventilators. The items were sourced both as separate items and as a complete kit. The nature of items have not been regular medical supplies, led to KEMSA seeking samples from various suppliers, and in this case, Megascope Healthcare Kenya Limited, which was contacted by KEMSA requesting submission of any samples that were available for quality checks to enable KEMSA determine if they would meet their specifications that guided quality assurance. And upon quality checks of the samples and sample acceptance, we were issued with a commitment letter dated 17th March 2019, asking us to deliver available quantities on delivery notes. We were also issued with a pre-inspection quality report of PPE kits that confirmed the samples we submitted of various PPEs were acceptable. We also received a distress call on urgent need for a ventilator to rescue a patient who had been admitted in Msambweni Level 5 Hospital on 23rd March 2020 with COVID-19 and was getting respiratory distress. On this, we had an available unit of a ventilator, and given the life-saving nature of the need, we were tasked to deliver the ventilator via flight to Msambweni to rescue the patient from distress call. Honorable Chair, I'm trying to demonstrate that we as Megascope Healthcare fraternity put our lives on the line to try and save lives in this country. The said ventilator was dispatched under delivery note number 22119 on the procurement process followed in supply of COVID-19 items to KEMSA. Upon establishing that we had the capacity to deliver on the COVID-19 related items, which we had communicated to KEMSA through samples submission, the direct procurement process was followed, and this is the chronology of events I just want to take you through, Madam Chair. One is the letter of intent to supply at the stated selling prices, which is, of course, in one of the submissions. Commitment letter to supply urgently required items specifying the quantity and delivery timeline. Number 3 was we delivered on delivery notes. And 4 was upon completion of delivery, we received invitation to tender for supplied goods. We then, number 5 is tender bids were submitted and negotiations were conducted by KEMSA, which were also minuted. Number 6 was award notification indicating negotiated prices that were issued, and letter of acceptance was issued in responses to the award notification. We were issued with contracts that we signed at the time for each awarded tender. And number 9 is local purchase order against each tender was also issued. Number 10, invoice to KEMSA was generated and submitted to them. Payment advice was to be issued to us on every outstanding payment. Number 12 is for items require after sales support, we follow up ensuring we install, commission, and also train the users on usage of equipment, including wearing the PPE kits. The COVID-19 pandemic brought about disruption of business and by extension the supply chain. So given that the items required were not regular supplies, we had to source all our supplies from China, who are the main global suppliers. And because the rule of demand and supply, production of items was hampered by safety measures, regulation, and only a few manufacturers were left in production. Global lockdown rendered limited air transportation. And accordingly, both the manufacturers and airlines adjusted their prices upwards. Of importance to note is the cost of air freight increased from $10 per kilo to $29 per kilo. One Medical Supplies, we have delivered COVID-related items as per the commitment letters and contracted signed. We wish to clarify that the following receipt of commitment letters that indicated quantities to deliver, Megascope Healthcare Kenya Limited pursued among the long-term overseas suppliers to determine who among them was able to supply an urgency on urgency basis. And therefore, Megascope Healthcare Kenya Limited settled on a non-medical company limited who had the items we needed available, albeit in piecemeal, due to the global shortage of both raw material and finished goods, coupled with a spike in demand for COVID-19 related items, especially PPEs. We further liaised with our other OEMs for supply of ventilators, and upon receipt of commitment letters, we immediately embarked on importation, which entails application of importation documents through the oversight authorities. Given the nature of the urgency, we were compelled to use the fastest available means to ship the consignments through chartered aircrafts and fastest direct flights. However, it's important to note that the consignments were shipped, airlifted, and delivered as the contractual obligation. And upon arrival, all shipments were delivered to our warehouses for quality checks, analysis, before delivery to KEMSA. Though we have fully complied and delivered on some of the commitments, Megascope Healthcare has not been paid to date. The delay in payment is a constraint to our cash flow, and as such has affected our operations. We would like to bring to the attention of this Honorable Health Committee that we were not only selling to KEMSA, but to private market as well. Just to name a few, we also supplied PPE kits to Nairobi Hospital at the same prices, and some even above the prices of KEMSA. In fact, it took us a long time to agree to supply KEMSA because of the constraint of prices at the time. We also supplied the Aga Khan University Hospital and also MEDS, who is the Mission for Essential Drugs and Supplies. So they also bought supplies from us as well. We did also supply to AMREF as well. And to date, we still sell ventilators, we still sell beds and COVID-related items to most of the counties and the private hospitals in this country. Madam Chair, it is my duty now to request this Honorable Committee, because Megascope Healthcare Kenya Limited has been adversely mentioned among few companies, about 8 in total, 12 companies. It is well to my knowledge, Madam Chair, that we have more than 60 companies, if not 100, that participated in tender at KEMSA during this COVID-19 pandemic. And to date, we still don't know the list of those companies, but we know the list of 8 companies. I would want, Madam Chair, because we are here, if it is possible, that we could also be able to know who are these other suppliers. We do know them. We know that they are able. We know that they are competent. But why single out on 8 or 12 companies? We want to know what kind of witch hunt that is there. And earlier I spoke, and I'm speaking now as a private a businessman, that today we are hurting not only established businesses, but also, remember, this COVID-19 is still with us. Today we know the government of Kenya is seeking to get some vaccines. I am sure, double sure, that the government does not do business. Where do you expect to buy these commodities, the vaccine? Isn't it the same companies you criminalize out here, that they are criminals and they're dealing with scandalous processes? These are the same companies you will come to at the time, the hour of need. And therefore, Madam Chair, I would want your protection from this Honorable Committee and also to the National Assembly to protect the private sector, to prevent businesses. I will tell you for a fact that today, any country, any foreign country will not be willing at the moment to come and invest here. It has been a huge fight for us those companies that we have partnered with them, to try and invite them so that we can come and also pitch tent in terms of manufacturing of medical devices, and also in terms of making sure that we have plants that can also be able to generate equipment for the region. It has become that difficult, Madam Chair. So for me, I do want, before I submit, to also ask our General Manager, Renny Rupalo, also to support my argument if he has any.
Thank you very much. Through Madam Chair, mine will be very brief. I'll just mention in terms of capacity building and knowledge transfer. It is indeed noted that this equipment which were imported were rare and different, but we've been doing them. However, after we have delivered this equipment, apart from the mask which don't need training, they're life-saving and they continue doing. As my managing director explained, we actually did not just deliver, install, and leave. We actually deliver, install, train, and commission, and do refresher training. Madam Chair, through your seat, I can actually confirm, like yesterday, we had a refresher training of ventilators in Olkalao. The same that we delivered to KEMSA, and then KEMSA distributed, and we went to install and train. We've done that in Makueni, we've done that even in Kijabe. So this is a continuous process we have done, not only for COVID, but for other projects that we have done across board in this country. Thank you.
Thank you. You can switch off your microphone if you're done with your submission.
So, Madam Chair, thank you very much for giving us that opportunity, and I submit.
Thank you. And just to put it on record, I don't think this committee has criminalized anybody. We are actually trying to unravel and find out the truth.
Madam Chair,
yes,
I meant this committee to intervene, and also through the National Assembly, to have policies that will protect us, not to be criminalized. We don't see how businesses in Kenya can be criminal, and especially local entrepreneurs are criminalized. We do have so many companies in this country and foreign companies working in this country. We have never had one being criminalized. But on the same tender, you hear the local company has been brought down by either those people who have certain issues or who actually have some grievances. So we are requesting that this committee to intervene and see it that we have a conducive environment. That was all, Madam Chair.
thank you. And thank you for your submission. We will quickly go to shop and buy. One of the reasons why we picked the two companies, I think I explained earlier, and for shop and buy, if you're here, I would like you to introduce yourselves. We had categories of the companies also that had supplied, and the CR12s were not available. Remember, we received the documents. So one of your company, by the time we received the presentation, the CR12 was not available. So introduce yourself and the team, and just go straight to answering the question. I don't want to go through it again. Don't go to we received the letter. We know that by now.
Thank you, Madam Chair and honorable members. My name's James Chelule, representing Shop and Buy Kenya Limited. With me is our company lawyer, Anthony Kibrono.
Madam Chair, my name is Anthony Kipron. I'm the advocate for Shop and Buy. Thank you.
Madam Chair.
Proceed. Just introduce your company. Are you just the two of you?
Now I will do it in brief. I think most of the what I wanted to mention, my other competitors have mentioned.
Okay,
I just want to mention what we do at Shop and Buy. We are a business, limited liability, registered in Kenya, dealing with medical equipment, farm machinery, household, among other equipments. So I will be brief on our deliveries, which we did with KEMSA.
Just for the records, when was your company registered?
On 14th of February 2020.
14th February 2020?
Yes.
Okay. Proceed.
Yeah, between the period early March and April, end of April, we were among the first companies to actually wholesale and sell all COVID products, starting from masks, PPEs, and other medical equipments, including beds, I mean hospital beds. And our offices are basically here in Nairobi, and we have branches across Kenya. So I wanted to start to say on April 29, 2020, we wrote a letter of intent to KEMSA that we had the capacity to deliver 100,000 complete PPE kits and another 100,000 K95 masks. On 30th April 2020, we received a commitment letter from KEMSA accepting our requests. On the same month, we started procuring the balances of what we didn't have by that period, and we managed to airlift most of our equipments, most of our PPEs, most of our kits, which included face masks, goggles, K95, among others. On 19th April 2020, we did another request, an extension letter to KEMSA because of the time limits. We had challenges with the airlines. We had issues with clearance of our goods, and they did accept our extension. And between 1st June and 10th July, we did all the supplies as per the commitment letters. And Madam Chair and honorable members, I want to maybe reiterate that since then, our company has not been called by KEMSA to do the tendering process, and therefore we've received no payments from KEMSA. I think mine is as brief as that. Thank you, Madam Chair. Thank you, honorable members.
Thank you for being brief, and I think I'll just start with you because you are brief, and then I'll ask members to just also be brief as we ask these questions. So you've indicated that you have delivered your items to KEMSA.
Yes, Madam Chair.
When did you deliver?
I delivered. You want to mention, or I give you the dates?
It's
or?
okay. You can just note the question is when did you deliver? And you have also indicated that since you delivered your items,
yes,
that KEMSA has not come back to you for negotiation.
Yes.
So as a businessman, are you worried if KEMSA today tells you they are no longer interested in your goods?
Yeah, Madam Chair, I'm really worried.
So you will answer that.
Yeah.
And also to, I think the similar case with Megascope. Now that I've seen with the Megascope that you gave first the letter, let me just be sure, letter of intent to supply at the stated selling price. Could you'll also, I would like you confirm to this committee that the commitment letter to supply that you were given by KEMSA, did it have stated price or not? The last one from me to Megascope, you've indicated that you have not been paid by KEMSA. And we have some document that the PS allowed KEMSA to spend money that was meant for World Bank. So would you kindly confirm whether there was any initial payment that was done? Because in our document, the first one that the ministry authorized, your company features as some of the one of the companies that was meant to be paid. That's all. I'll go to members so that they can just ask a round of questions and finalize. Honorable Dr. Eseli and Honorable Joyce, Honorable Jagagwa, Honorable Adagala.
Chair.
In that order.
Mine is not really a question. I'm just intrigued, and I don't know, the surprise would be an understatement that a company incorporated in February, in a space of about 2-3 months, have landed an order worth $1 billion plus. It's, I'm mesmerized, that's all I'm saying.
Okay. Honorable Joyce.
Mine is very brief, Chair. I thought you had asked shop and buy the issue of CR12. Did you, Chair, ask about that?
CR12?
Yeah. And I think they didn't respond.
They will respond. No, okay. You can just ask.
Because
so
you had said that
they are just noting the
yes,
questions.
And then the second one, to Crown, did they say they have also filed a civil suit, the High Court, against the nation? Because I think that didn't come out clearly as it did with
Shop and Buy, kindly switch off your microphone. Thank you. Take it up again. There was feedback from the audio recording. Just the last comment.
Okay. Chair, I would like Shop and Buy to answer the question on the CR12, and then Crown to confirm whether they have also filed a civil suit against Nation Media. Thanks.
Thank you. Honorable Dagala.
Yeah, thank you, Chair. I just wanted to ask Megascope, Mr. Gatia. You have not specified how much was your tender at KEMSA. And also, I'm seeing here you are a shrewd business person. You have several interests. Won't it collide the chamber and your personal company? That's all, Chair.
Honorable Jagago, then I'll go to.
Thank you very much, Madam Chair. Permit me, Madam Chair, to ask one direct question to gentleman called James Kipketa Chelule. Then once he answers that, then I can ask another 2 questions, kindly.
You ask and then
just one. He answers that, then I'll go to the next, please.
They are all being noted, Honorable Jagagwa, so just ask your questions.
The first one will form the basis of my other one question.
Proceed.
So, James Kipketa Chelule, the director of Shop and Buy. How much are you owned by KEMSA in total?
970 million.
970 million. That is close to just 30 million shy of $1 billion. True?
That is true.
Thank you. So, let me make a statement, Madam Chair, before I ask a question. You know, we have been dealing with this matter for the last 3 or so weeks. And the concern that Kenyans are asking is how a company incorporated in this year or in 2020, just when COVID has broken out in the world, without any business history, because I'm certain, like the procurement people from KEMSA are saying, is that they need to know the person they are dealing with. KYC, know your customer well. This is a company which was incorporated going by the certificate of registration and CR12 from the Register of Companies. It was actually incorporated on 2nd April 2020. And within 2 months, it has earned business worth $1 billion. So when was KEMSA able to have gotten to know the company that they were dealing with so that they could give them such huge amounts of money? And then I'll ask now the question, Wanachelule. Had you been previously been shortlisted or pre-qualified to be supplying KEMSA with other items?
Yes, Your Honor. Let me mention first that
I want to indulge Honorable Jakagwa, just ask your questions as other members did.
Yes.
Then they can come in and answer.
Actually, I did.
Yeah.
I asked to the chair. But my concerns were like those other raised by other members, that a company which was barely a month old, by the time KEMSA stopped buying from them, they owned $1 billion. I've asked about whether, now the other question I'll ask is, when KEMSA top management was here this morning, and when the board of directors were here last week through the chair, there was an indication that when these goods were bought, they were bought at a higher price, and when you are requested as suppliers to supply these goods, there is room for negotiation, or negotiations of the pricing. And I'm certain even the chair has posed that question to somebody else. Now that we know that, going by the emails that have been exchanged and the correspondences that has been exchanged between KEMSA and the ministry, there is literally no money to pay for some of these items. Are you ready, through the chair, to renegotiate your prices from up the skies to something reasonable so that Kenyans can get value for their money and value for the goods that they're buying? Thank you.
Thank you, Honorable Jakagwa. Actually, my question was the figure you have given us, 970, is based on what price? Because you have not negotiated yet, and your commitment letter didn't have a figure in it that you are given by KEMSA. Honorable Wino?
And Chair, that is my question. This delivering and then negotiating is quite unique. Do you have an agreement, MOU or a contract that says, I deliver, then we negotiate, then my payment will depend on what we negotiate? Meaning, the prices of those things have dropped. Are you willing to get the money that they are worth now? Number two, which is the last one, it's interesting, as other members have said. You register a company on 4th February 2020, and you boldly tells this committee that you have branches across the country. Can you give us some few physical locations for these branches across the country? And lastly, Megascope, we have already intervened for you. That's why in my statement I said, you take the opportunity or leave it. Explain to Kenyans. But Chair would also be interested to know who is criminalizing Megascope so that we can intervene objectively. Thank you, Chair.
Thank you. I don't see any other interest. Honorable Nikal, as the final one, so that then we will start the response.
Just a small concern for Megascope. You're actually the same, leading the same process that was trying to get masks for Kenyans, which we are very concerned has really delayed. Here at the same time, we are also selling the same items to KEMSA. would one be wrong to think that you actually have a conflict of interest, that it really wouldn't matter to you whether those masks take forever to get to Kenyans?
You are done? Thank you. I think we'll start with the Crown, because yours was just, I think I just had one question addressed to you. Then we come to Shop and Buy, we finalize with Megascope.
Thank you, Madam Chair. On behalf of Crown Healthcare, we do wish to confirm and clarify that indeed we have instituted legal action against the Nation Media Group. This is in form of a complaint before the Media Council, which is also attached to the bundle submitted before this committee at page 451. Thank you, Madam Chair.
Thank you. Anything else that Crown you'd like to say? Any other additional information that you feel you would have wanted to give this committee?
Madam Chair, all that we needed to say on behalf of Crown Healthcare as relates to our dealings with KEMSA are detailed in the bundle that has been submitted to this committee.
Thank you very much.
That's all, Madam.
Shop and Buy?
Yeah, I think I will start with the question about CR12. The only time KEMSA will request for CR12 is during tender process. However, with you, I supplied you with my CR12.
Madam Chair.
What is out of order?
Is a gentleman in order to misread this committee? If you look at your file, the bundle of documents, sorry, I want to take mine for storage. If you look at the bundle of documents on the letter of award, which was signed by the procurement director, at the bottom of that letter, it clearly states furnishers with a CL12. So is he speaking from a knowledgeable position, or is it just guesswork? Because if you look, there's a generic letter on all the letters of the award that were given to the suppliers. At the bottom of that letter, this is very clearly in bold, furnish us with CR12. So how can you purport to be speaking for KEMSA? Or did you want to mean that you work for KEMSA?
No,
you have some insider dealing.
I'm saying I have not been given an award.
Honorable Jakago, I think
mine is only a commitment.
You have been with us. It's this reverse thing, procurement. It's like they furnish the documents when you have even delivered, and then that's when you negotiate, then the tender is awarded. It's done the opposite. And the same explanation was given when the KEMSA appeared and the CR12 was asked. They said they have not negotiated, so they do not have the CR12. I think that's what the gentleman is alluding to.
Are we saying that KEMSA is acting like a storage, that he can bring his goods from wherever he bought them from?
Exactly.
Deliver them to KEMSA's warehouse as a storage? And when they wish to buy them, then they'll buy them? Is that the position?
That's a question I was asking the gentleman here.
Quite interesting, Madam Chair.
Proceed.
Yeah, now, the second very important question is the question about our company being formed in February and able to deliver the goods in 2 months' time or 3 months' time. One, I want to state first that I'm a businessman and into other businesses, and maybe my background, if you can understand, I'm a real estate merchant, and I have been in business for the last 15 years. Now, how I did maybe and manage and supply KEMSA is because I had friends, I had suppliers who were ready to support me and to support Kenyans in that matter by supplying the COVID-related items within the shortest time. I want to also reiterate that just before I was given the consent by KEMSA, I was already selling the same things throughout the month of March and the month of
order,
April.
Madam Chair. Once again, point of order. You know, there's what we call an entity. We are not concerned about his other entities. We are concerned about the entity called Shop and Buy. He's been brought here by an entity called Shop and Buy. So if we have other entities, that's up to him. But we are saying our curiosity is drawn to the fact that Shop and Buy was incorporated in February, and by May, it had supplies of $1 billion, $1 billion. So other matters aside,
let me hear Honorable Dagala and members. I would like, sometimes when members appear or members of public appear before the committee, it's good for us to allow them just to express themselves. We will judge later. So if he says his other businesses may have, given him networks, I don't know, let him finish his explanation. I think it will be right. Honorable Dagla, you had an intervention also?
Yeah, I just wanted him to, I can see from the Companies Act, this one is dated here 18th June 2020. So how did it get that contract as early as that? And I can see the certificate here is showing 18th June.
Yes, proceed and answer those questions.
I think I was trying to explain how we managed to supply within the shortest time, though we were registered in February. The other question, Madam Chair, is that the delay in payments as a business person really affects our operations if we are not paid as early as possible. We also have suppliers who actually gave us credit from abroad. We have people who stood for us on credit, and I'm requesting this House to, just like the way my colleagues requested, that they should be able to assist the business people of this country get most of their requests and special payments from entities or other companies, especially government entities. That is it.
Mr. Chalula, I think one of the questions that was raised by members, and I want to again repeat it. Now that this arrangement that came in with emergency of procurement of these COVID items was done in reverse, your goods are already at KEMSA. Yeah. What are they worth, or what are the current market price by now that you'll be negotiating with KEMSA? Because KEMSA commitment letter, from what we have seen from the documentation, didn't have a price. So right now, how are you willing to negotiate? Because again, you said you have not been called for negotiation. So are you still stuck with the original price, or are you at the market rate? Just for clarity.
Of course we will negotiate. We are here to negotiate.
Okay. Well noted. So then we'll conclude our negotiation. How much
Madam Chair, you cannot let that pass through the answer. We are here to negotiate. We don't negotiate for KEMSA. He cannot negotiate with KEMSA.
It's not with us, isn't it? It's not, of course, with us.
You shouldn't let that pass, Madam Chair.
Could you just repeat again? You're ready to negotiate with who?
We are ready to negotiate with KEMSA.
Okay.
Then, Chair, that brings complications. As they ask us to intervene, how do we intervene in a negotiation that we do not know how will end?
You know, that's why this morning we asked KEMSA to provide to us a documentation on who they have negotiated with, they have not paid, and who has not gone through negotiation, and they have not paid, because we cannot purport goods worth 7 billion has been bought, and they have not paid for them. So what prices are we dealing with? I want to go to Megascope.
Chair, this is very interesting. You're going to negotiate. So how did you even come with that KEMSA owes you half 900 million? It is just that the store, and you have your lawyer there. Bless us be educated. We are not lawyers. What is the limit of this? We are not negotiating. But suppose, like now, if you are talking of masks, we were buying them at say 300. Now they are 20 shillings. So how is this negotiation going to be made? Two, in just these 2 months you incorporated yourself. Others can argue that they have been in the field, KEMSA know them. How did you get in touch with, what was your contact with KEMSA? How did KEMSA even know about you? You are not in the market, you are building houses and selling. Suddenly in 2 months, you are buying medical equipment. How did you get in touch with KEMSA, or how did KEMSA get in touch with you?
I will answer that. I was saying between 1st March and the whole of April, I was supplying masks, the 3-ply masks, to my clients who were supplying to KEMSA. And that is how I knew KEMSA, and that is how KEMSA knew about our...
So you are supplying to local clients who are supplying KEMSA.
Yes,
Why didn't KEMSA take your clients?
No. I was supplying suppliers of KEMSA.
Yeah, I think.
Okay.
Why didn't KEMSA take the suppliers instead of you?
Through the chair, let him admit whether he was a broker, a middleman.
But we're saying he was suppliers of KEMSA. Maybe just to help you,
That is right.
Mr. Chelule.
Right. Okay, let me...
What I would suggest...
Maybe I'm mixing myself. What I'm trying to say, KEMSA, as other suppliers, my colleagues have mentioned here that we have almost 60 people who are not brought here. Most of them were supplying small numbers of masks and PPEs.
And they were buying from you.
And they were buying from me.
So if you're able to give us a list of, because there is what you have supplied to KEMSA,
yes.
If you're able also to furnish us with a list of others that you supplied to, that would also help us.
Madam Chair, if you give me time, I will actually be able to
You know,
furnish
maybe
you
it's
that.
because of experience. I think from Crown to Megascope, they said we also supply Nairobi Hospital, we did what, and there's documentation attached. So if you're able to do that, we'll appreciate.
Yeah, I will do that.
Okay. Megascope. Who is that? The lawyer?
Yes.
Yes.
I think the Honorable Nikala raised the issue of on what basis Shop and Buy will be negotiating. If you look at the letter that Shop and Buy wrote to KEMSA, they gave indicative prices of the K95 masks and the PPE kits. This is the letter dated, sorry, just a minute. It is a letter dated the 29th of April 2020, in which they did indicate that PPE kits they were willing to supply at 9,500 and the KN masks at 800 shillings each. Madam Chair and members of the committee, these were the prices at the time, and it is Shop and Buy's position that the negotiations will be based on the prices at the time, but they are willing to negotiate down if need be, or if their costing permits under the circumstances. Thank you, Chair.
And if there's no agreement, Chair,
yes.
And if there's no agreement, because remember this public money, and the people here, the people who, these committees, the committees that actually give money to KEMSA, or even through the ministry, if it's our feeling that, oh, this has not been negotiated, well, we can't now let government money go like that. and we say no, will it say, okay, too bad, 1 billion gone? Anyway, it came too quickly in 2 months. It could also go.
You know, Madam Chair.
Chair.
What is it? I just actually wanted to just, there are several letters here. 9th April 2020, actually even your way of communication to KEMSA. Supply of KN95 face masks. We shop and buy wish to supply 100,000 KN95 face masks, and that's it, regards. There's nothing else. Then
Madam Chair, there's another letter.
I'm with you, 14th April. Then you say, we shop and buy wish to supply 100,000 complete protective suits. This include, and then you say that, no price. Then 29th April, you now write at that letter. So request to supply, this is where you now say PPE at what cost? 9,500. The K95 at 800 shillings. Then KEMSA replies on 30th, quite fast, 29th, 30th, and says, we have now given you these PPEs, quantity 100,000, K95 100,000, but they do not indicate the price, the cost, or what they are giving you. They tell you it should be in the warehouse or on or before Wednesday, 20th May 2020. When did you deliver?
I did the last supply on 10th July.
10th July.
The last supply.
So also, let's appreciate that from then, May 2020, then you did your 20th July supply. By that time, the prices had gone down.
No, but I imported all of them around May. The only challenge which we had at that point, as I mentioned earlier, was that we had logistical problems with the flights.
So you said you imported them around May?
We imported some.
Because the challenges were there between March
and April and May.
Then May, people started bringing in these things.
No, it was April and May, when we still had a lot of challenges.
Anyway, okay, it will be interesting as a committee to watch how this will go. And the question that I have been asked, so if KEMSA says, you had said 9.5, if they can say we'll buy at 5,000, what will you do?
During negotiations, you don't disagree.
Oh, you don't disagree. Thank you very much. You are a nice man. Very, very, very good.
Madam Chair, how do you contrast that with council's views that my client will sell them at the initial cost? So which one stands in the answer? Is it the council's submissions or the council is an agent?
Council
principal is Chelule. So which should stand in the
answer? I will go with the principal. Council has been contracted to just come with the principal. The principal is the final word. He has said he's ready to negotiate.
Thank you, Madam Chair.
And he has said he will not disagree.
Madam,
thank you.
Just to put it this way to Mr. Chelule. Mr. Chelule, you're not doing business perhaps maybe you're not used to doing business in Nairobi or this government, businesses in government.
Are you alluding that is not from Nairobi?
I don't
what
know,
information do you have?
No, I'm just saying. And Madam Chelule, it's important such a company that is going to engage government and engaging in big tenders like this, it should have a proper structure where you have a chief executive. Sometimes it is good to be a chair of a company, so that not necessarily that you must appear to struggle so much. So you struggle so much raising money and mobilization of resources and networking in business. But then you leave the CEO to do day-to-day activities. I think if you had a CEO, all your issues will have been sorted out. They will have actually explained the registration of the company within 2 months. And if I have a competent chair who can mobilize $1 billion, and there is a venture here,